October. Ito naman ba? 22. Pupunta na daw si Pastor. Kaya mo siya. Nabantay doon. Nabantay niya. Baka kapagay tayo dito. Ayun pa. Ito ka ba?
Ba't walang sound?
Hello? Hello? Naririnig ba? You can hear?
Opo.
Okay. Do we want to start already? But can the audience hear?
Yes, we can hear you.
O sige. So let's start. Magandang hapon sa lahat. This is Michael Tan. Akong maging moderator ninyo ngayong hapon. Ang event natin ay galing nga sa isang sambayanan at ang pamagat ng ating session ay Talakayang Bayan para sa Kalusugan. Isang bayan, isang laban sa COVID, isang tunguhin sa kalusugan. Napakahalaga nga itong paksa natin, lalo pa para sa ating ang pinakabagong political alliance ng mga democratic forces sa Pilipinas. So I would like to go straight to the introductions. Ang pinakamahalaga, ang ating dalawang Filipino Sign Language interpreters. Ang nagsasign ngayon ay si Ginong J. Maisel at mamaya papasok na naman si Binibining Ember Parpa. Okay. May ano din tayo dito, itong broadcast ay nasa Facebook din. Pero wala akong nakitang, ipa-flash ba ang links dito? Will it be flashed?
Automatic po siya, Doc, sa Facebook page ng Isang Bayan, and also it's also on Rappler and the pages of the organizations that helped with this forum.
Okay. So again, it is there it is, no? Facebook.com, yung site ng Isang Sambayanan, which is One Sambayanan Official, no? Doon kayo papasok, no? At nasa Rappler din at saka sa mga partners natin. I will announce the partners if I can bring it up. Naku, nakaano kasi dito eh. Ayun. Ang mga organizing partners natin ay Filipino Nurses United, ang Akbayan, National Akbayan Party List, Akbayan Youth, ang Likhaan Center for Women's Health, ang Council for Health and Development, at ang Caritas Novaliches. So welcome again to our session on health, no? Talakayang Bayan para sa Kalusugan. Magano na tayo ngayon ng pambansang awit.
Wala pong audio.
mga kababayan, ang pambansang awit ng Pilipinas.
Kayang mag-ibig, kaya sa sinakanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisigil, sa nagatang tutok sa simoy at sa langit ng pagaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nagtinig, ang ituwin at araw niya kailan pa may di magtitig. Luman ang araw ng warhabing pagsinta, buhay langit sa piling mo. Ang inigaya na pagkay magamin, ang mamatay ng dahil sa'yo.
Napansin niyo ba? Parada na ng parada sa malalaking mga kalsada, itong liyamad at liyamadista ng ating inang bayan. Mukha'y nakaimprenta sa higanting tarpaulina, pati nga sa truck ng basura, handang-handa na sila sa halalang bayan. Pagdating sa may plaza, may sayaw at kanta, harana at manyanita, pampasigla sa taong bayan.
Sir, just to clarify, you're going to block the renewal of franchise of ABS?
Committing a crime.
So you're gonna block their...
Yes! Puntang ina, harap-harapan, magkolekta kayo.
Akalain mo ba, pinakalakpakan pa itong pagmumura matapos ipasara ang istasyon at media na lingkod ng bayan. Samantala, ang mga biktima ng sakuna at pandemya, bigas at bakuna ang inaantabayanan.
Bakit gano'n? Pinakasan nila ng gano'n-gano'n na lang yung anak ko na wala silang ebidensya na ang anak ko isang kuryero na binibintang nila.
Ito ba ang palisigan? Sa araw ng giyera, laban daw sa droga at drogista, libo-libong pamilya kung walan ng ama, asawa at kuya. Ba't ganon? Pagyagit ng lipunan lagwak, pagpuslit na bilyunan lusot.
Pinaril si Alvarez sa likuran noong Lunes sa Bacolod City nang di pa nakikilalang salarin. Doble dagok ito para kay Palabay. Anong araw na iyon, inilibing lang ang peace consultant at anak pawis chairman Randall Ichanis na tinorture umano.
Sa ngalan ng kampanya na kontra-terorista, dose-dosenang abogado at aktivista ang duguang pinatumba. Karaniwang kriminal, bugbog. Kakutsabang opisyal, busog.
There are still presence of Chinese ships at Julian Felipe Rift in the West Philippine Sea.
And do you think China will just give it freely because of the United Nations demand? Yan ang hindi ko maintindihan kay Carpio.
At sa ngalan ng diplomasya na chika-chika sa China, buka ka ang puwerta, saka na raw muna ang purit soberanya. Dukhang mangingisda, lugmok, sugapang banyaga, pasok. O poong may kapal, dinig mo ang daing ng mga ulilang bunso at panganay. Dama mo ang bigat sa mga balikat na walang hanap buhay. Kaakbay ka namin sa pagluluksa at pakikipaglamay. Kakampi ka namin sa pagtuligsa sa kanang panghahalay. Palayain mo ang mga ikinulong ng walang katarungan. Palabasin mo sa pagtatalukbong mga alagad ng mga simbahan. padalhan mo naman kami ng mga pinunong matino at marangal. Yun pong hindi bastos o ganapal at huwag na huwag pong kriminal. Pinunong may puso na kayang yumuko sa nasalaylayan. Walang lansa ng dugo ang kanilang pangalan at angkan. Pinunong uusig sa mga gahaman na kawatan, pinunong didilig sa binhing katapangan ng bagangit baylan. Pinunong hihilom sa kairaming sukat sa aming sasayan, pinunong pupukaw sa pagiging kapwa at pagkamamamayan. Pinunong may pagturing sa sari-saring lahi at kasarian, pinunong may pitagan sa biyayang gubat at mga karagatan. Pinunong loob ay dalisay, palakad ay mahusay, at kagalang-galang, makadiyos at makabayan, walang labis, walang kulang. Ngayon, hayaan ninyo akong panatay mabigkas. Sa gitna ng lahat, oo, iniibig ko pa rin ang Pilipinas. Duyan ang magiging alab ng puso, silanganing perlas,
Salamat. Yan ang isang minutong pagtanda sa mga fallen healthcare workers natin. At sana tandaan din natin ang mga kababayan nating nagtatrabaho overseas. Marami ding mga healthcare workers na nag-alay ng buhay nila. Ang susunod naman sa programa natin ay welcome remarks kay Justice Carpio, isang convener ng Isang Sambayanan.
This group represents the democratic forces in the entire country.
Pangalan ng grupo ay Isang Bayan at sa ilalim nito ay yung tapat na pamumuno at maginhawang pamumuhay.
Mahirap magsinungaling sa kabataan, mahirap magkunwari na yung bukas ay magiging maganda para sa kanila. And that's exactly why this group was formed.
Everybody we invited joined us from the left to the right. You have Bayan Muna, you have Magdalo, and they were groups. You have the poor, you have religious groups, the established traditional parties, all of them. They said, yes, it's time that we join forces. government that's dedicated, that's faithful to the Constitution.
Hanapin yung mga taong pwedeng magpakita ng tapat na pamumuno.
We have decided to come together to choose who are the best candidates for president, vice president, and for senators in the 2022 presidential elections. The purpose is that we should have the best candidates who will institute good governance in the country. It's a matter of an educational campaign. Everybody in society, whatever class you belong, you must understand that without good governance, we will never progress. Government funds will always be squandered. People must think. You have to look at the track record, the integrity, the character of the people you want to elect.
Tao sa puso, hindi lang yung labas sa ilong. Ang daming pinapangako, wala namang maibuga.
This government is really incompetent. They've been tested and everybody is saying, kulelat sila. So we have to offer a better alternative to our people because we don't want the same thing to happen again, to continue in the next 6 years.
Sino nga ba yung alternatibo? Di ba? Unang-una, tumututol sa patayan. Sa sukatan niya.
Ang leader, yung maaaring tumayo, will stand tall despite power around you.
If you have a president who says, I will jet ski to Scarborough, and then when he becomes president, he gives away Scarborough to the enemy, what will happen to us?
Kung gagalaw ba ang International Criminal Court, susuporta ba siya? Papatuloyin ba niya ang mga investigador? Yung traffic, ano ba ang tingin niya dyan? Ang Mindanao, ano tingin niya sa mga kababaihan? Ang tingin niya sa moralidad, sa kultura? Paano ba siya ginamit ng salita? Puro ba mura? Puro ba pambabastos?
Sana makahanap tayo ng isang Pilipino na handang magbigay ng buong buo para sa bayan.
Kaya nating buhayin ang ating bansa na hindi tayo nagpapaalila sa ibang nasyon, hindi tayo nagpapatuta sa mga bayan. Gusto lang tayo pagsamantala. Sana matuto tayo kung gaano katapat sa atin ang Diyos, maging tapat din tayo sa bayan na kanyang minamahal.
This is a matter of national survival for us because we have to bring back good governance, respect for human rights, integrity and honesty in government.
Thank you. Susunod ay Dr. Lenny Hara.
Ito ang unang town hall meeting o Talakayang Bayan ukol sa kalagayan ng ating sistemang pangkalusugan. Alam natin na hindi huwaran ang ating sistemang pangkalusugan. Marami sa ating mga kababayan ang hindi naaabot ng serbisyo nito. At sa panahon ng pandemya, nakita natin na ang pamahalaan ay tuluyan ng nahubaran sa pag-aanyong maayos ang pampublikong sistemang pangkalusugan. Ang Isang Bayan ay nais maghain ng agenda sa kalusugan para sa ating mga Pilipinong At mapalad tayo at mayroong mga tagapagsalita sa ating Talakayang Bayan, isang community health worker na nagkasakit ng COVID-19, isang nurse, at 2 mga kilalang respetadong manggagamot na parehong naging kalihim ng kagawaran ng kalusugan. At talagang magiging masigla ang ating Talakayang Bayan dahil ang ating magiging tagapagpadaloy o moderator ay si Dr. Michael Tan na kilalang kolumnista at dating chancellor ng UP Diliman. Sa ating mga naririto at nakikinig sa Talakayang Bayan ngayong hapon, ay maaari tayong magtanong at magkomento either sa Facebook o sa ating Zoom sa ikalawang bahagi ng ating town hall meeting. Kaya't halina Isang Bayan, isang laban sa COVID-19 at isang tunguhin para sa kalusugan. Maraming salamat po.
Maraming salamat, Dr. Hara. Mag-umpisa na tayo sa mga speakers. Ang unang speaker natin, ito ay recorded video ni Amelia Dumopoy, isang community health worker ng Caritas Novaliches at recovered patient ng COVID-19.
Ako si Amelia Dumopoy, community health worker at staff ng Caritas Novaliches na pinangangasiwaan ang labor ministry bilang program coordinator. Bilang naging isang COVID patient at COVID survivor, masasabi ko na isa akong maswerte. Dahil dito may bago akong naging karanasan na pwedeng maibahagi sa inyo. Mula sa ano ang naramdaman, naiisip, paano ako nahawa, at ano ang nakapagpakalma sa akin, bakit ako nakasurvive. Pangatlong araw at pang-apat na araw, pabigat na ng pabigat ang aking nararamdaman. Pang-limang araw nang tinanong ko na ang kaibigan kong doktor, kaya pinainom niya ako ng lagundi, turmeric, at paracetamol kung may lagnat. Pero walang lagnat. Ang banggit niya nasa ilalim na di pa lumalabas. Nagkukwentuhan na kami ng aking anak. Kung positive ka, tiyak positive din ako, ang sabi niya. Inahapunan, dito na ako nagkaroon ng lagnat, 37.5. Tapos baba uli, hanggang next day, pinakamataas kong lagnat ay 38.3. Nung ako'y nasa ospital, umabot ito ng 38.8. Dito tumawag ang aking nakausap na umupo. At kinumusta niya ako dahil meron siyang sintomas. At agad silang nagpa-swab test. Ang result, positive. Kaya na-confirm ako na nahawa ako sa kanya. March 24, pang-6 na araw, umaga, nagpasya na kaming mag-ina magpa-swab test para matiyak namin ang aming kondisyon. Bukod sa talagang medyo nahihirapan na rin ako sa aking nararamdaman, nang nag-uusap kaming mag-ina, ang sabi namin, i-assume na namin na positive kami. Dahil sa mga sintomas, bukod pa sa tumawag sa alma ko ang aking sarili bago ko ginising ang aking anak para tingnan din niya ang kanyang resulta. At iyon, parehas kami. Lumala na ang aking pakiramdam ng araw na ito. Sobrang sakit na ang aking ulo ng hapong iyon. Dito ko naisip na kaya pala di ko masisisi ang iba na bumigay dahil sa hirap ng kanyang nararamdaman. Sobrang sakit, sobrang bigat ng aking katawan na sinasabayan pa na sobrang sakit ng ulo. Nilalagyan ng aking anak ang aking ulo ng malamig na tubig at pinaiinom na niya ako ng paracetamol na every 4 hours. Dahil ito na ang advice ng birth at siya ay nagtanong at nireport na ang aming kondisyon. Minomonitor na kami kada umaga at hapon at kinakausap siya ng doktor na kinabukasan, March 26, kukunin kami at ipapa-x-ray. Kaya dinala na kami sa quarantine facilities, ngunit pinakuha muna kami ng gamit sa bahay dahil ang desisyon ng ospital, dali na kami sa quarantine at tatagal kami ng 10 araw. Sa pagkakaroon ko po ng karamdamang COVID, hindi ko man lang naisip na baka ako mamatay. Bagamat mahirap ito, ngunit naunawaan ko at naramdaman ko kung bakit mas ginugusto na nila ang mamatay dahil sa hirap ng nararamdaman. Iba-iba ang kwento inyong maririnig. Ang masasabi ko lang, nakita ko ang buong larawan ng may mga karamdaman sa loob ng quarantine iyon. May mga masisigla at walang nararamdaman o asymptomatic na nagpapalakas ng loob sa tulad namin. Nakapagpakalma po sa akin, sarili, ang lahat kong naranasan at nasaksihan sa quarantine iyon. Mula sa pasyente na iba-iba ang kalagayan, ang mga health worker na walang sawang nagbibigay ng serbisyo kahit sila ay napapagod dahil sa dami naming dapat i-monitor. At higit sa lahat, ang iniwan kong mga manggagawa na sa panahong ito ay nawala ng trabaho dahil bahagi po sila ng aking pinangangasiwaang ministry sa diocese. Iniisip ko, marami pa akong dapat na magawa. Kailangan ko bang makatulong sa kanila?
Okay. Ewan ko kung naputol ang video o tapos na, no? Aling Amelia, tapos na ba yan? Alam ko kasi recording yan.
Putol po.
Naputol? Hintayin ba natin ang na ibalik ang video?
Okay na yun siguro.
Sige, mag-sharing ulit tayo sa open forum, no? Pakilala ko na ang susunod na speaker natin, si Maristela Abenujar ng Filipino Nurses United, no? At maraming nakakakilala sa kanya sa mga iba't ibang mga mass organizations sa Kalusugan, no? So, ang video naman ni Maris, please.
Ako si Amelia Dumupoy. Ako si Amelia
Marami pong salamat sa ating butihing tagapagpakilala, isang makabuluhan, mapagpala, at nagpupugay na pagbati sa ating lahat. Ngayong hapong ito ay akin pong ibabahagi sa inyo ang kasalukuyang kalagayan ng ating mga frontline health workers sa gitna ng laban na COVID-19 pandemic. Hayaan po ninyo na gamitin ko ang isang PowerPoint presentation upang malinaw na mailarawan ko ang kalagayan ng ating mga frontline health workers. Ayan. Alam po nating lahat na matindi ang labang ito sa COVID-19, lalo na po sa ating mga frontline health workers na direktang humaharap sa ating mga mamamayan na nagkasakit ng COVID-19. Mabilis po na lumipas ang isang taon simula nang harapin natin ang pandemyang COVID sa bansa. Naitala ang mahigit 1 milyong kaso ng COVID pagpasok po ng April 26, 2021 at patuloy pa rin po itong nadadagdagan. Sa pananaw ng mga frontline health workers, ang kanilang kalagayan ay maaaring mailarawan sa dalawang kataga, napapabayaan o neglected at napagsasamantalahan o exploited. Mali ba na isipin ng ating mga frontline health workers na sila ay napapabayaan ng pamahalaan? Sa gitna ng pandemyang COVID, ay buong sipag at tapat nilang ginagampanan ang pagkalinga at pagliligtas ng buhay kahit ramdam nila ang takot para sa sariling kaligtasan. Bakit may takot ang tinatayang 1.7 million na frontline health workers? Dahil ito sa katotohanan na sa loob ng mahigit 1 taon nilang halos pagmamakaawa na mabigyan ng libre, sapat at angkop na mga personal protective equipment o PPEs, ay kinakailangan pa rin nilang magtiis sa di sapat at di angkop na PPEs sa loob ng 12 oras na pagtatrabaho o mahigit pa. Marami rin sa kanila ang bumibili na ng sariling N95 mask, face shield at ibang PPEs upang makaiwas sa COVID virus. Mistulang alay sa digmaang ito laban sa COVID o sacrificial lambs ang mga health workers. Sa ganitong kalagayan sa trabaho, umabot sa mahigit 17,000 health workers ang nagka-COVID dahil sa kanilang diligtas na trabaho. At ayon mismo sa DOH, 88 sa kanila ang nasawi sa COVID nito lamang unang linggo ng Abril. Ang mga pangakong Bayanihan 2 Active Hazard Duty Pay or AHDP at Special Risk Allowance or SRA na nagkakahalaga ng 136 para sa AHDP at 227 para sa SRA sa bawat araw ng aktwal na pagtatrabaho mula September hanggang October 19, 2020 ay natanggap lamang ng ating mga health workers nitong nakaraang Marso at Abril ng taong ito. Ang mga kontraktual tulad ng job order at contract of service ay hindi nakatanggap. Ito rin ang karanasan ng mga kasamahan natin sa local government units o LGUs at maging sa mga pribadong sektor. Simulaan ng December 20, 2020 hanggang ngayon ay wala pa silang natatanggap na AHDP at SRA. Sa mga nagkasakit naman ng COVID-19, ang nasa press release ng pamahalaan na 15,000 piso para sa mild at moderate at 100,000 piso para sa critical at severe at 1,000,000 piso naman para sa mga namamatay sa COVID ay sobrang bagal ang pagpoproseso at pahirapan ang approval. Sa katunayan, may ibang health workers na 2 beses nang nagkasakit ng COVID-19, subalit ang kanilang benepisyo noong sila'y unang nagkasakit ng COVID, hanggang ngayon ay hindi pa rin po nila natatanggap. Tila band-aid ang tugon ng pamahalaan sa panawagan ng mass hiring o karagdagang mga nurse, doktor at iba pang health workers. Ang malaking kakulangan sa COVID-19 response ay nagpalala sa dati ng suliranin na understaffing. Ang paglilipat o pull out ng mga health workers mula sa ward na walang COVID patungo sa mga COVID ward, ang panawagan para sa mga volunteers, ang pag-hire ng mga emergency workers na nasa contract of service lamang ang eskema ng kalagayan nila, ay mga walang job security o kasiguruhan sa pagtatrabaho. Pagod na ang ating mga frontline health workers. Ang 14 na mandatoring araw para sa quarantine at ang pagkakaroon ng COVID test tuwing ikalawang linggo ng pag-duty ay hindi rin po na ipapatupad. Walang malasakit sa kalusugan at kaligtasan ng mga frontline health workers. Bukod diyan, ay patuloy na napagsasamantalahan ang ating mga frontline health workers sa anyo ng mababang pasahod, di sapat na mga benepisyo, at di makataong kalagayang paggawa. Isang konkretong halimbawa ang nararanasan ng mga nurses natin sa pamahalaan. Sa halos 20 taon na paghihintay nila para maipatupad ang salary grade 15 o ang katumbas na 32,053 pesos bilang entry salary sa batas na Philippine Nursing Law noong 2002 ay hindi pa rin po ito laganap na naipapatupad. Kahit na po may kautusan ang Supreme Court and Bank noong October 8, 2019 ay hindi pa rin ito nasusunod. Sa katunayan po, ayon sa Department of Budget and Management, ang mga kontraktual nating manggagawa tulad ng job order at contract of service ay walang employee-employer relationship. Kaya sila man ay nanatili sa salary grade 11 o mahigit 20,000 at hindi nakatanggap ng salary grade 15. Sa pribadong sektor naman, ang isang nurse ay tumatanggap lamang po ng 537 na sahod kada araw o ang katumbas nito ay 11,814 sa isang buwan. Yan ay naaayon sa minimum wage law. Mas mababa iyan pagdating sa mga probinsya labas ng National Capital Region. Kaya dahil marami pong mga pribadong sektor ang hindi sumusunod sa minimum wage law, ang tinatanggap ng mga nurse natin sa private sector ay nasa 5,000 hanggang 8,000 sa isang buwan ang average. Sagad sa pagsasamantala sa lakas paggawa ang nararanasan ng mga nurse at iba pang mga frontline health workers. Nariyan pa po ang walang awang pagpapatupad ng demotion in rank mula sa inilabas ng Department of Budget and Management na Budget Circular 2020-4 kung saan ang mga nurses na ang posisyon ay Nurse 2 hanggang Nurse 7 ay bumaba ng tigi-isang rank. At ito po ang dahilan kung bakit marami po sa ating mga senior nurses ang matindi ang demoralization hanggang ngayon. Nawalan ng kabuluhan ang kanilang maraming taong pagsisikap at sakripisyo na maabot ang kanilang mga pinaghirapang posisyon. Sa halip na promotion, ay demotion ang kanilang naranasan. Ang mga benepisyo naman gaya ng libreng meal, accommodation o tirahan at transportasyon sa panahon ng pandemyang COVID ay laganap ang hindi pagpapatupad. Kahit nga ang performance-based bonus or PBB noong taong 2018, 2019 at 2020 ay hindi pa rin natatanggap ng ating mga health workers sa pamahalaan. At kapag ang isang health worker po ay nag-quarantine o kaya ay nagkasakit ng COVID-19, sa panahon na sila ay lumiban o hindi nakakapasok sa trabaho, ay tinatanggalan pa po sila ng mga benepisyo mula sa Magna Carta of Public Health Workers gaya ng hazard pay, ng meal allowance or subsistence allowance na tinatawag, at ganun din po ang kanilang mga laundry allowance. Ito po ang kalunos-lunos na kalagayan ng ating mga frontline health workers pagdating sa mga benepisyo. Ang lahat ng ito, ang buwis buhay na gawain sa harap ng pandemya at lalong tumitinding krisis na pang-ekonomiya sa ating bansa, ay nagtutulak po sa marami na magbitiw sa kanilang trabaho o mag-resign, mag-early retirement, at humanap ng ibang oportunidad, lalo na ang pagtatrabaho sa labas ng bansa. Sa mga nagbalak naman na sila ay lumabas ng bansa, sila ay naging biktima ng inilabas ng pamahalaan ng nakaraang taon na deployment ban, kung saan po ang 14 nating mga health workers, hindi lamang po nurses at doctor, marami pa pong mga health workers ay hindi pa pinayagang lumabas. At November 2020 na, nang hayaan ang ilang mga nurses natin na lumabas sapagkat naglabas sila ng lifting ng ban, ngunit meron pong 5,000 na cap na ipinataw. Ibig sabihin, mula po 2021 ay 5,000 nurses lamang ang kanilang papayagang umalis bawat taon. Masasabi po natin na ang ating mga health workers ay tila ginigisa sa sariling mantika. Hindi sapat ang proteksyon. Sila ay napababayaan, bulag at bingi ang pamahalaan sa mga kahilingan ng mga health workers. Ang kanilang pagkakasakit at posibleng pagkamatay ay actually po may negatibong epekto sa maayos na serbisyo ng ating pamahalaan sa pagbibigay ng sapat na serbisyong pangkalusugan sa mamamayan. Kaya marami po ang ating mga kasamahang frontline health workers ang ngayon ay nagkakaisa. Para po sa kanila, kailangan nilang mahigpit na manindigan at matapang na magpahayag ng kanilang mga kahilingan sa pamahalaan. Maaaring sa paraan ng mga dialogues sa iba't ibang ahensya ng pamahalaan o mga virtual public discussion. At ang iba ay napipilitan ng lumabas sa kanilang mga ospital upang maglunsad ng sama-samang pagkilos tulad po ng sit-down protest at mga vigil. Lehitimo ang kahilingan ng ating mga frontline health workers. Kapakanan ng mga pasyente at ng sambayanang Pilipino ang kanilang pangunahing tinitiyak. Kaya sana naman mabilis at maagap ang pagtugon ng ating pamahalaan. Ang mga pangakong bayanihan 2 at iba pang mga press releases ng ating pamahalaan ay dapat nang maisakatuparan. Nananawagan din po ang mga frontline health workers sa ating pamahalaan na itigil na ang pananakot at pagsasagawa ng red tagging sa pangunguna ng National Task Force LCAC. Sa halip po na kami ay paratangan na terorista, sana po kami ay inyong bigyan ng sapat na proteksyon. Hindi po gawaing terorista ang pagliligtas ng buhay ng mamamayang Pilipino. Ang mga nurse, doktor, komadrona, mga barangay health workers at iba pang frontline health workers na itinuturing nating buhay ng mga bayani sa ating bansa ay dapat pinapahalagahan at nirerespeto ang kanilang mga lehitimong karapatan. Mabuhay ang lahat ng mga frontline health workers. Magandang araw po sa ating lahat.
Maraming salamat, Maris. Nakinig na tayo sa isang pasyenteng COVID survivor nga at nakinig din tayo sa isang frontline worker. Ngayon, papasok tayo sa, may dalawa tayong guest speakers ngayon ay parehong dating mga secretaries of health. No? Ang mauuna ngayon ay si Dr. Esperanza Cabral. Siya isang cardiologist and clinical pharmacologist. No? Matagal nagturo sa College of Medicine ng UP. Naging director ng Philippine Heart Center, naging Secretary of Social Welfare and Community Development, at naging Secretary din, Secretary of Health. Ang topic niya ay COVID crisis and the needed response. Dr. Cabral?
Maraming salamat, Mike. Magandang hapon sa inyong lahat. Ako po ay naatasan na gumawa ng isang presentasyon tungkol sa COVID crisis and our needed response. So yan po ang ating pag-uusapan in the next few minutes. And can we have the next slide, please? Okay. Noon pong mga unang araw ng December 2019, ay nakapag-report po ng cluster of pneumonia cases of unknown origin na galing sa Wuhan, China. Yun ang pinag-umpisahan ng ating pandemya tungkol sa COVID-19. At mga 2 buwan pagkatapos noong January 30, 2020, ang unang kaso ng COVID-19 ay nakita dito sa ating bansa. So ang pag-uusapan natin ay what happened, what did we do, what more should we do, at what future will we have. Next, please. Doon sa tinatawag na Health Systems Framework ng World Health Organization, ang kauna-unahan dun sa sinasabi nilang building blocks ay ang leadership and governance. So masasabi natin na ito ay first among equals doon sa 6 building blocks for the health systems framework ng World Health Organization. Ang health leadership and governance, kung ito ay mahusay, ay magbibigay ng accurate information, clear directions, tools para sa implementasyon ng kung anuman ang iniuutos at direksyon ng leaders. At bukod doon ay importante na magbigay sila ng inspiration at motivation dun sa mga tao na susunod sa kanilang mga utos. So yan po ay isa sa pinaka-importante na tugon natin sa anumang problema tungkol sa health systems, pero lalong-lalo na sa pandemya. Dito sa tinatawag na National Action Plan, next please, ng ating gobyerno, next slide please. Yan. Okay, thank you. Ay makikita kung ano ang strategy at governance na gustong gawin ng ating pamahalaan sa pagsugpo sa COVID pandemic. At dito sa National Action Plan, next please, ay meron silang mga phases na tinatawag ayon sa panahon. So, nung March to June 2020, ay meron silang tinawag na phase 1 at ang kanilang strategic objectives ay magbigay ng clear, accurate, and timely information to support operations, to contain and mitigate the spread of COVID-19, at to sustain the conduct of operations against COVID-19 and mitigate the consequences and impact of the condition. After that, sa kanilang phase 2 na ginagawa mula July hanggang September 2020, ay tutuloy nila kung ano man yung ginagawa nila sa phase 1. Pero sa phase 3 na nangyari noong October to December 2020 ay dito nila inumpisahan ang tinatawag na Philippine National COVID-19 Vaccine Roadmap at nagsilbi or sa palagay nila ay magsisilbi na transition plan to the new normal. Dito natapos yung National Action Plan na nakita natin, wala pang phase 4 pero alam naman natin na kailangan yun dahil hanggang ngayon, first at magse-second quarter na ng 2021 ay nandito pa rin sa atin itong pandemya na to at lalo pang lumala. Next slide please. Ano ba ang mga ginamit ng ating pamahalaan para sa pagsugpo ng COVID-19? Ito in simple terms are yung ating health protocols na ipinasunod sa atin. Diba? Yung pagsusuot ng face mask at face shield, pag-exercise ng physical distancing, paghuhugas ng kamay, at hindi pagpunta sa mga crowded places. Yan yung mga health protocols na pinasunod nila sa atin. Nagpasunod din sila ng border control. Merong panahon na isinara ng ating pamahalaan ang ating bansa at hindi pwedeng makalabas ang mga Pilipino para pumunta sa ibang bansa at hindi rin naman pwedeng pumasok sa Pilipinas ang mga ibang tao na may gustong pumasok dito. Nagkaroon din tayo ng community quarantine, meron tayong testing para sa COVID, meron tayong contact tracing ng mga tao na na-expose dun sa mga meron ng COVID. Nagkaroon tayo ng isolation at quarantine. At finally, kung meron kang sakit na COVID, ay dapat ay ginagamot ka. Bukod dito, dahil alam natin na maraming tao na maapektuhan ang buhay, ekonomiya, ay dapat magpapatupad din ng assistance para sa socio-economically displaced. Next, please. Ito yung mga minimum public health standards na ipinatutupad hanggang ngayon at merong panahon at na ang pagpapatupad nito ay ginamit ang military at ngayon na naman ay gusto na naman ng ating Pangulo na gamitin ang pulis at military sa pagpapatupad nito. Next, please. Ang travel bans ay nag-umpisa noong January 30. At ang unang travel ban ay para sa mga nanggagaling sa Hubei na probinsya kung saan nandun ang Wuhan. After that ay sumunod na ang buong China at ang mga special economic zones ng China, yung SARS. At bukod doon ay nagkaroon na rin ng travel ban sa ibang bansa. Next, please. Ang ating community quarantine ay tinatawag na the longest lockdown in the world dahil magmula noong March 16, 2020 ay nasa ilalim tayo ng one form of or another of the community quarantines. Noong March 16 ay nagpataw ng enhanced community quarantine. Niluwagan ito at naging modified enhanced community quarantine noong May 15 at lalo pang niluwagan noong June 1, naging general community quarantine na lamang. Habang niluluwagan ang community quarantines ay makikita naman natin na tumataas yung numero ng mga tao na merong COVID-19 dito sa ating bansa. At tumating ang panahon na yung mga health workers ay nagsabi na time out muna. Kaya noong August 2 ay bumalik tayo sa modified enhanced community quarantine. Tapos after 2 weeks, pinalik uli sa general community quarantine. Medyo gumanda ang ating datos sa mga nagkakaroon ng COVID dito sa panahon na ito hanggang dumating ang Marso at noon makikita natin itong surge ng COVID-19 na ngayon ay dinadala natin kaya noong March 29 bumalik tayo sa modified enhanced community quarantine. Magmula noon ay bumababa naman na ang mga kaso such that mula sa pinakamataas na kaso bawat araw na mga 15,000 ay ngayon ay mga close to 8,000 na lamang per day ang kaso ng COVID-19 na nakikita dito sa ating bansa. Ito ay isa sa mga unang resulta ng community quarantine. Siyempre, nung i-announce nila na bawal nang lumipat ng mga lugar, ay lahat ng tao na gusto nang pumunta kung saan sila nakatira. Kaya yung mga tao ay nahirapan dahil sa kulang na ang transportasyon, kulang na ang mga buses, at kulang na ang mga MRTs na tumatakbo. Hindi lamang noong March 16 naging problema ito. Ang problema natin sa transportasyon para sa mahihirap lalo na at sa working class ay hanggang ngayon ay abot pa dahil hanggang ngayon ay kulang ang mga transportation para sa atin para tayo ay pumunta sa ating pinapasukan at umuwi sa ating mga bahay. Next please. Next, please. Okay. Tungkol naman sa testing para sa SARS-CoV-2. As of April 25, 2021, mahigit 11,500,000 na ang total tests conducted. At tayo ay uma-average ng 52,000 o higit pa tests a day at uma-average ng 49,000 at higit pa na individuals tested a day. Dito sa bagong surge na kinakaharap natin ngayon, kung saan ang positivity rate ay umabot sa 20% or 25% pa nga, ay tinatantya na kailangan ng 130,000 to 160,000 tests per day. Pero ang average lamang natin ay nasa 50,000 per day. So sa ngayon ay kulang ang gawa nating testing para malaman kung sino ang may COVID at sino ang walang COVID dito sa atin. Next please. Siguro ay tayo sasang-ayon kay Mayor Magalong ang ating contact tracing tsar. Pag sinabi niya na ang contact tracing ay ang weakest link sa ating pagpapatupad ng COVID response. Siya na mismo ang nagsabi na contact tracing does not go beyond the household of COVID-19 cases. Kung titingnan natin, ang dapat na output ng contact tracing ay 37 persons per case. Okay? Ibinaba na nga ito sa standard na 15 persons per case dahil very obvious na hindi natin kayang tuparin yung 37 per case. pero ang actual output natin ay 1 hanggang 6 persons traced per case lamang. So pinakamahina talaga sa ating pagtugon sa COVID-19 ang ating contact tracing. Next please. Marami na tayong itinayong isolation and quarantine facilities. Sa ngayon, we have 23,000 beds in 602 facilities nationwide. At tinatarget ng DPWH na magdagdag ng 3,000 more beds in another 120 facilities dito sa ating isolation and quarantine facilities. Iba-ibang klase itong isolation and quarantine centers na to. Merong tinatawag na mga megaligtas COVID centers. Meron tayong mga mobile o modular isolation and quarantine facilities. Meron tayong mga isolation and quarantine facilities na itinayo ng mga LGUs mismo. At syempre, meron tayong mga quarantine hotels kung saan ang ating mga OFWs at returning Filipinos at iba pang mga tao ay nagko-quarantine muna bago sila palabasin. Okay? Ito namang treating, next slide please, ay makikita natin na ngayon, wala sa inyo, I'm sure, na hindi nagkaroon ng taong kakilala, kaibigan, kamag-anak, malapit na kamag-anak na hindi nagkaroon ng COVID dito sa surge na nararamdaman natin ngayon. At na-experience ninyo personally or narinig ninyo kung gaano kahirap pumasok sa ospital kung ikaw ay mayroong serious case of COVID at nangangailangan ka ng ICU care. So ito ay importante at hindi tayo nakatupad ng dapat natin sanang gawin dito sa treating of COVID-19 cases. Next please. Meron tayong 456 level 2 or 3 hospitals dito sa ating bansa. 41% ay government-owned at 59% ay private hospitals. Meron silang mga 2,335 critical care beds in their 450 ICUs. Okay? Ito ay 3.1% of the total bed capacity of level 2 and 3 hospitals countrywide. Dito sa NCR, 75 hospitals with 802 ICU beds ang meron tayo. And an additional 77 hospitals able to take care of moderate to severe COVID-19 in non-ICU settings. Next, please. Yun namang tungkol sa ayuda kasi syempre pagka ang tao ay hindi mo pinayagan na makapagtrabaho ay wala siyang pera para bumili ng kung ano man ang pangangailangan nila sa pagkain at iba pa. Nung sa Bayanihan 1 ay meron tayong ayuda na tinatawag na 5,000 hanggang 8,000 pesos para sa isang tao o isang pamilya na naapektuhan ng COVID crisis. Pero maririnig tayo na hanggang ngayon ay hindi pa nila natatanggap yung ayuda na galing dun sa Bayanihan 1. Okay? O kaya kung natanggap nila ay hindi naman ito nakakasapat at maraming problema sa pagdidistribute ng ayuda dahil hindi klaro kung sino yung mga beneficiaries. Mahirap mapapasok doon sa listahan ng beneficiaries kung ang pangalan mo ay wala, kahit na ikaw ay dapat ay nandun. Maraming palakasan at politicking na nangyayari at yung mga distribution venues para sa ayuda ay nagiging lugar para sa pagkalat ng COVID-19 dahil nagiging siksikan ang mga tao sa pagkuha nila, sa kagustuhan nilang makakuha ng ayuda na napakabagal naman ng distribution. So yan ang mga nangyaring siguro masasabi natin kakulangan sa pagbibigay ng social assistance dun sa mga tao na na-displace economically sa mga ginawa nating paraan para makontrol ang COVID-19. So, asa na tayo ngayon? And ano pa ang kailangan nating gawin? Next slide, please. Nung ibigay ko ang aking presentation sa kanila, which was May 2, ang datos ko ay nasa May 1 lamang. At nung time na yon, 9,226 cases were the new reported COVID-19 cases. And there were 120 new deaths. Itong 9,226 cases na to, actually bumaba na yan mula dun sa pinakamataas na 15,000 mahigit sa isang araw na na-experience natin nung first week of April. Okay? Pero ang hindi bumababa ay ang number of new deaths. Before this particular surge, usually ang number of new deaths natin ay nasa mga 20 or 30. Pero ngayon, pumapalo sa mahigit 100 new deaths araw-araw dito sa surge na nararamdaman natin ngayon. Next, please. Meron na tayong more than 1 million cases dito sa ating bansa. Ang interesting point about this is that the first 500 cases were reported from February 2020 to February 2021. Pero magmula nung March hanggang sa April, another 500,000 cases were reported. Okay, so talagang napakatindi ng pagtaas ng mga dami ng nagkakaroon ng COVID itong 2 buwan na nakalipas. Next, please. Siguro ito ang dahilan kung bakit nagbigay ng memo sa Presidential Communications Operations Office na dapat ay ipakita ng lahat ng government platforms ang world data para masabi na ang Pilipinas ay mas mahusay kesa sa maraming ibang bansa sa ating pagtugon sa pandemya. Medyo nasasaktan na siguro ang pamahalaan natin sa lahat ng batikos na tatanggap nila at sa mga nagsasabi na kulang at hindi tama ang ating pandemic response. Next, please. But ang katotohanan ay ang Pilipinas has the highest daily confirmed new cases in Southeast Asia dito sa panahon ng surge na ito. Mas marami pa kaysa sa Indonesia that has twice the population of the Philippines, and certainly mas marami dun sa ibang bansa na mas maliit ang populasyon. Ang impact ng crisis na ito sa ating economy ay makikita dito sa graph na ito. Next, please. Kung saan makikita natin ang quarterly real gross domestic product ng Pilipinas, yung red line, kumpara sa Indonesia, yung yellow line, at sa Vietnam, yung blue line. Makikita natin na pinakamatindi ang pagbaba ng ating GDP kumpara sa Indonesia at Vietnam. Yung Vietnam nga halos hindi bumaba ang kanilang GDP at after 6 months ay tumaas na uli ito. Sa Indonesia naman bumaba pero mas mataas pa rin ang GDP growth nila kesa sa Pilipinas. Ang ating pagtugon dito sa pagbaba ng ating ekonomiya ay kulang din. Next slide please. Ito ang fiscal response ng Pilipinas. Yan yung fourth bar kumpara sa ibang lugar. At itong dotted lines na ito ay ang global average fiscal response. Makikita natin na kulang ang ating fiscal at liquidity support as a percentage of our GDP as of the end of last year. At ito ang dahilan kung bakit talagang nahihirapan ang ating mga kababayan dahil dito sa COVID-19. Next, please. With our poor performance at testing, tracing, isolating, treating, and providing social assistance to the socio-economically displaced, it looks like our only way out of this pandemic is magpabakuna tayo para magkaroon tayo ng herd immunity. Ang tanong ay kaya ba nating gawin ito para maisalba ang ating mga buhay at ang ating mga kabuhayan. Next, please. Ito ang datos ng bakuna as of May 1, 2021. Wala yung isang 1. Anyway, ang total doses in the country at that time was 4,025,600 doses of various vaccines. As of now, we actually have 5,500 plus doses of vaccines in the country dahil dumating ang kalahating milyon na bakuna galing sa Sinovac at 1.5 million na bakuna galing sa AstraZeneca. At madadagdagan pa ito, magiging 7 million mamayang hapon or bukas kasi may dadating pang iba. So dumadami naman ang bakuna dito sa ating bansa. But as of May 1, vaccinated Filipinos who have had their first dose was 1.5 million and more than 200,000. Ang nakatanggap na ng second dose. As a percentage of the population fully vaccinated, we have 0.23%. As a percentage of the population with at least one dose, we have 1.6%. As a percentage of the 70 million fully vaccinated Filipinos na goal ng ating pamahalaan, it's 0.35%. And as a percentage of 70 million with at least one dose, we have 2.6%. The daily vaccination rate is 35,000 per day. Pero ang pinapangarap na time to herd immunity ni Secretary Galvez ay December 25 para magkaroon tayo ng Merry Christmas. At si Secretary Duque naman ay medyo conservative ng konti at sinabi niya na baka March 31 bago natin maabot, 2022 bago natin maabot ang time to herd immunity. Kung ito ang pinapangarap nila at sana ay mangyari nga ito, ay kailangang taasan ang daily vaccination rate mula sa 35,000 per day hanggang 350,000 hanggang 500,000 per day. Hari nawa ay mangyari ito. Dahil kung hindi, ay aabot pa sa 2022 at sa 2023 at baka 2024 pa bago tayo mabakunahan ng tama to reach herd immunity. By that time, ibang pandemya na siguro ang ating haharapin. Next, please. These are the share of people who received at least one dose of COVID-19 vaccine dito sa mga lugar na ito. At makikita natin na tayo ay pang-tatlo mula sa huli. Ang Singapore, ang pinakamarami na ang mga tao na nakatanggap na ng at least one dose of COVID-19 vaccine. So mula noong December 2019, when this cluster of pneumonia cases of unknown origin was first reported in China, ay umabot na sa 150 million mahigit ang mga kaso ng COVID-19. at 3 million mahigit ang mga namatay dito sa buong mundo. At dito sa ating bansa, mahigit 1 million cases at mahigit 18,000 deaths ang inabot na magmula nung pumasok ang COVID-19 dito sa atin noong January 2020 hanggang nung April 30, 2021. Ano ba ang kailangan nating gawin para ano pa ang kailangan nating gawin? Well, unang-una syempre ay kailangan sana natin ng mas mahusay na liderato na magbibigay sa atin ng klarong direksyon kung ano ang dapat nating gawin. Pero bukod doon, ay kailangan nating gawin ang mga ginagawa na natin ng mas malawak pa at nasa panahon. Lahat tayo, at lalong-lalo na ang pamahalaan, ay kailangan magkaroon ng sense of urgency. Hindi yung business as usual at kung hindi ay hindi lahat tayo makakalampas dito. Bukod doon, lahat tayo ay kailangang magtrabaho, mag-cooperate with each other. At ito naman ay handang-handa naman ang pamayanan na makipag-cooperate. Sabihin lang sa atin kung ano ang gagawin. Bigyan tayo ng mga kailangan natin para magawa natin kung ano yung pinagagawa sa atin. At huwag pabayaan ang ating mga frontline workers para merong mag-alaga sa atin. At huwag pabayaan ang pamayanan na magutom habang ginagamot itong COVID-19 pandemic. Maraming salamat sa inyong lahat at sana ay ligtas kayong lahat. Ligtas ang praning. Thank you very much.
Thank you very much, Dr. Cabral. Ang Dr. Cabral ay nagtutok sa sa COVID-19. Ang susunod naman na speaker natin ay isa pang dating Health Secretary, si Dr. Manuel Dayrit. Ang kanyang paksa naman ay Building Better Healthcare for the Future. So, although mukhang matagal pa itong pandemic, kailangan medyo forward-looking sana tayo. No? Konting biographical information kay Dr. Dayrit. Dr. Dayrit o si Manulet ay galing din sa hanay ng mga community-based health programs. Right after college sa Davao del Norte siya nagtrabaho. Tapos pumasok nga siya sa DOH. His line of work has been epidemiology and public health. Sa health department, siya ay naging director, assistant secretary, at naging secretary or minister of health from 2001 to 2005. Sa panahon niyang naabutan niya ang SARS in 2003, ala natin noon malala na yan. And because of his efforts there, he was known as the SARS Tsar. Marami siyang ginawa dito sa infection control, disease control nga sa dengue, TB, polio. And of course, nag-promote din siya ng low-cost generic medicines at pinalawak ang PhilHealth. From 2005 to 2012, si Manulet ay naging director of the Department of Human Resources for Health in the World Health Organization sa Geneva. Tapos bumalik siya dito sa Pilipinas, naging dekano siya ng Ateneo School of Medicine and Public Health na may dual degree nga ng MD at saka MBA. I'm sure marami kayong nababasa tungkol sa, tuloy pa rin siya sa efforts natin sa COVID-19 as an advisor sa IATF at saka sa Department of Health. Dr. Dayrit?
Maraming salamat, Mike. Ang hapon sa inyong lahat. Masaya ako na naririto ako para magbigay ng konting presentation. Siguro sisimulan ko na sabihin sa inyo na nung binigay itong topic na ito, sabi ko kay Lenny, naku Lenny, napakahirap ng topic na yan. Pero susubukin kong pag-usapan rin yan. So, meron akong ginawang presentation na I hope i-share ko ngayon. At sana maunawaan ninyo kung nasaan tayo dito sa health systems natin. Malinaw ba ito sa inyo? Mike, nakikita ba ninyo?
Nakita. Ano, yung PowerPoint wala pa.
Wala
Wala pa PowerPoint.
Okay, sandali kasi
Tech support, pakitulong lang.
oo. I'll share the screen again.
Screen,
How's this?
Okay. You're fine now, Manalet.
Okay. Oh. At saka isasara ko yung aking video para yung bandwidth.
Yeah, okay.
Okay. Okay. I hope you can see that. Okay, ito yung topic na binigay sa akin, building better healthcare for the future. Ngayon, kung iisipin niyo yan, itong building better healthcare, pag pinag-usapan ng health systems, siguro the best way I can describe it is to try to compare the health system with a building. So I'll try to describe yung health system natin, ikukumpara ko sa construction, design at construction ng isang building. Pero ang health system mas komplikado. And then after that, pag-usapan ko yung current design at state ng health system natin ngayon. Pero hindi ko matatalakay lahat. I can mainly talk about maybe how we're organized in healthcare delivery at saka yung financing, among other things. Pero more complicated din to. And siguro sa question and answer pwede natin pag-usapan pa ng iba. At saka pangatlo, I'll give you some ideas on how to build better healthcare for the future. Pero these are just thoughts that still have to be discussed with people. Ito, pinikap ko ngayon sa internet. Kung isipin mo ito, isang lumang building na sira-sira na. Tapos pinaganda nila. Tapos siyempre, ayan ang cost para gawin yan. Ngayon, kung iisipin niyo itong building na yan, nag-umpisa yan with a good design. Yung structure, nandyan yung living room, dining room, bedroom, kitchen, garage, garden, etc. etc. Tapos siyempre, kung gagawin mo na yan, kailangan mong gumamit ng good materials, you have to employ good workers and craftsmen, good supervision. So you get the idea. To develop a good building, you have to have very good design and very good construction and very good workers. Ngayon, kung iisipin ninyo ngayon, kung kailangan ngayon natin mag-renovate, mas mahirap pa mag-renovate. Kasi hindi ba pag nag-renovate ka, you're left with an old structure, and then you have to make sure na kung may gigabayin kang pader dyan, walang mga electrical connections na nandyan. And therefore, in a sense, ganito ang gusto natin gawin. Pag tinanong na how can we build better for the health system, we actually have a health system already. Okay, maybe dismayado tayo, it's not functioning as well. Paano natin i-improve yan? Yan essentially ang tanong for this presentation. Para maintindihan natin yan, ito isinalarawan ko dito, maybe in a very, very simplified format. Ito yung balangkas ng isang bahay o ng isang health system. Okay. Kung titignan ninyo dyan, there are people and there are the providers and there are the state. Okay? Sabihin na lang natin, those are the actors. Pero these actors have to work together to achieve yung tinatawag nating health status, yung health outcomes natin. Okay? Lahat malusog. Mahaba yung life expectancy. Okay? Walang malnutrition. Yan ang mga health status na gusto natin. Para ma-achieve natin yan, health service delivery, kailangan natin. Okay? Ngayon, kung titignan mo yung laman ng health service delivery dyan, public health services. Ambulatory care, yan ang parang OPD at saka inpatient care. Pero kung isipin mo yung tatlong services na yan, sa COVID-19, that all came into play. Hindi ba? Yung tinatawag nating contact tracing, testing, treatment. in a sense, that's all part of public health services, and yung treatment, part of inpatient care. So, kung kinakapos tayo dito, kailangan natin maintindihan kung bakit ay in-explain ni Secretary Espinal yung some of the problems there. Okay? Pero itong service delivery na yan, halimbawa, kailangan masuportahan yan ng financing mo. Paano fina-finance yung ating service delivery? Alam natin, there's money from taxes. Alam natin, there's social insurance and there's also private insurance. It's a small percentage. And then alam natin that really the private expenditure, actually the people and the private sector, comprises 70% of the financing of the health system. And then nandiyan yung input management mo. Maliliit lang ang mga letter dyan, pero napaka-importante lahat. Yung mga tao, human resources, narinig na natin from, Maris, for example, the nurses, mga doktor, mga pharmacists, and of course, all of the paramedical personnel. Kailangan lahat yan. You need the medicines, including the vaccines. Kung kulang yan, may problema tayo. You need the knowledge and technology as well as the capital for that. And for example, kung isipin niyo, saan nakalagay dyan yung mga ospital? Pwede natin isasama yung ospital dito sa inpatient care, mga ospital. Okay? And mga health centers, nandyan, under ambulatory care, in public and private. And then of course, the whole health system has to be brought together with good oversight. Ito yung natatawag na governance or good governance. Right policies, right regulation, very good information. Isa sa mga problema natin yan, we don't have very good information. At the start of the pandemic, we didn't have a information system. Actually, yung datos na present ni SP kanina, that was actually created over months when they had to build the information system for COVID. And then, of course, strategic partnerships. So this is the health system. Ang question ngayon dan, how does that function so that ma-achieve mo yung health status? How are the people served? And how do the people participate? How do the providers actually work and work together? Public and private, how do they collaborate? And of course, the state. Nandiyan ang policymakers, nandiyan ang politicians. Ngayon, yan ang balangka, sabihin natin, ng ating health system. Ngayon, ano yung disenyo? Okay, how is our health system designed? Before I go there, tignan natin some examples from other countries. Okay, tignan niyo ito. These are countries na linagay sa isang libro ni Britnell, who was once the chairman of KPMG, so a international management firm. Tignan niyo ang lahat ng mga countries na linagay niya dyan. Linagay niya because of certain exemplary characteristics, certain excellence points. Nandiyan ang UK, nandiyan ang Israel, yung primary care ng Israel, napakaganda. Nandiyan ang Brazil, very good community services in the Amazon. Nandiyan ang Australia for mental health. Nandiyan ang Nordic countries, including Sweden, for good health promotion. Nandiyan ang Africa for patient empowerment. Ang US nandiyan because of research and development. Nakikita mo yung mga vaccine platforms galing dyan sa US. Nandiyan ang India for innovation and speed in technology. Singapore for information technology. France for very good choices. Switzerland for their financing, and Japan for their aged care. Ngayon kung isipin ninyo ngayon, there's no perfect health system. Tignan ngayon ninyo itong mga bansang ito. Ilan dyan ang doing well sa COVID? At ilan dyan ang hindi masyado? Bagamat excellent ang ibang mga parts of their system. US ba, masasabi mong for all their wealth, maganda ba yung response nila? Brazil, for all of their wealth as well and community services, maganda ba yung response nila? India, they were producing vaccines for the world. Tinamaan sila ng surge. Ngayon, hirap na hirap ng oxygen. Israel, nangunguna sa immunization. UK, nangunguna sa immunization. Australia, walang COVID doon. If I were to just summarize the country and the pandemic response, sasabihin ko na the countries that essentially did well in COVID, I would say one, were the most proactive, were the best organized, were so well integrated in their services, and were effectively led. Yung apat na yan. Proactive, organized, well integrated in their services, and effectively led. Makikita na ninyo sa media lang eh. UK, makikita mo, every day, di ba? Makikita mo, umaakit yung vaccination rate sila. Israel. The news from the US, kalat-kalat, di ba? When you hear about India, also the same. Okay? So I think this is a lesson for us. If we are to have a good pandemic response, our health system has to have all of those characteristics. I guess we were not proactive enough. Di ba? Late pa nga yung response natin eh. We certainly weren't organized. And as I will show you, we're not very well integrated. And I think Estes already told you whether we're led or not. So with that, let's go to design. Ito na yung design ng system natin. Okay? To be fair naman, and to honor our past, our lawmakers actually wanted to design a good health system. And when you look at it from 1954 to 2021, there were 45 laws passed. 12 laws from 1954 to 1991, 33 laws from 2000 to 2021. We have an average of one law every 1.5 years. That's a continuing design of our health system. Sa papel. Are you curious what these laws are? I'll tell you. Ayan, from 1954. Tingnan lang ninyo muna yung mga may stars. Kung gusto nyo the RHU Rural Act, that was the one that created the RHUs. Actually, 1954 pa yan, yung RHUs na create nila noon. Pareho pa rin ang configuration niya yun, if you think about it. Philippine Medicare Act, that led us down the road to social insurance in 1969. Generics Act for cheaper medicines. Ito, milestone to local government code. For those of you who understand this in the public sector. And I'll explain that later. The National Insurance Act. This was the act that actually eventually created PhilHealth. No advance payment for hospitalization. Magna Carta for health workers. So you can see that, our system is, the design of our system has it in our laws. More laws. Philippine Nursing Act, which Marisa Benohar described. National Insurance Act amended in 2004. Again, no detention in hospitals. Kalusugan pangkalahatan. This was not a law, but this was a policy of Ninoy Aquino. Si Pinoy. Anak ni Ninoy. And of course, the syntax law. This was the syntax law that allowed for, set the stage for universal healthcare. More laws. Look at this. The Insurance Act again, and then in 2019, the UHC law. So yung UHC law, that actually came about because of previous laws and enactments that allowed us to say, sige, covered na lang Pilipino. Okay? To the extent that you can cover the senior citizens, you can cover the people with disabilities, and then of course, Bayanihan 2, Bayanihan 3, and Bayanihan 1. If you were to summarize all of that sa design ng ating sistema, tignan ninyo. 21 laws on health service delivery. 6 laws on healthcare financing. Think about that diagram that I gave you. 5 laws on social insurance, coverage, and access. 4 laws on human resources. 3 laws on pharmaceuticals. You have then tobacco, nutrition, and disaster laws, including dangerous drugs. So ang question ngayon, with all of the laws that we have enacted, bakit ganito? Are the laws at cross purposes? Are the laws adequately funded? Are the laws well implemented? So with that, go to the present. UHC Act as part really of ambition natin, 2040, and then the Philippine Development Plan. So may mga plano. Bakit, why is our system not working as well? We've got all of these nice designs. So we're severely challenged. Well, unang-una, ang dami may hirap sa bansa natin. So that has to be solved. And that health sector can't solve that by itself. Uneven capacity across the health system. Alam natin yan. From urban areas to rural areas, many areas that are remote and disadvantaged, yung tinatawag na GIDA areas. Ito, napakamalaking bagay ito, underinvestment. Kasi tayo, I have data on this, pero I won't show it kasi masyadong madami pang datos. Pero compared to our neighbors, we're underinvesting per capita. And then whatever monies that we have, poorly utilized pa. When I started as DOH secretary, 10 billion ang budget. Many years later, umabot sa 160 billion ang budget. Pero sinasabi nila, utilization rate was probably about 50-60%. Ito, lack of skilled, motivated, equipped health workers at various levels. I don't have to explain that. And this inability to upgrade our institutional capacities purposefully and sustainably. Ibig sabihin, yung institutions natin parang pareho pa rin. And then here, I'll just tackle this loss of synergy of the whole system given the decentralization of its parts. Then I'm talking about the public health system here. Also, I'll go into that. Ito. Local government code. This was considered, if you talk to the lawyers, they think that this is a milestone excellent law. The lawyers will tell you. But if you talk to the health workers and the people that actually had to work under this law, including the local governments, sasabihin sa inyo, talagang hirap. And I was in the department when this was passed, and I was secretary when I had to work, given these provisions. But what has it done? In this diagram, you can just see here, halimbawa yung problema lang, just from financing. Just look at the financing, okay? Nagkaroon na internal revenue allotment, supposedly to the provinces, municipalities, and facilities there. The mayors and the governors will tell you, kulang na kulang itong pera na ito. Of course, the money was not earmarked for health, so they probably used it for other things. Okay, but nonetheless, the devolution of the health services to the local governments did not have enough resources for these local governments to actually implement it. So for many years, bagsak yung services at the local government level. And this is a diagram that shows it. Napaka maganda, no? Napakalinis. Tignan ninyo. Are you missing anything here in this diagram? Tignan ninyo. There are no lines here between the red national government, the provincial, the city, and the municipality. So actually, when you think about this, maayos yung paghahanay nito. Segmented yung sistema na yan. There's no administrative control. from the top down. So how do you expect, particularly in a time of a pandemic, that you can have a lot of coordinated activity? Magbababa ng policies from wherever, the IATF, pero i-interpret pa yan. Okay? Tapos kanya-kanyang implementation. Okay, so the system was not organized, neither was it well integrated. So if you think of it, this is the situation with the signing of the law in 2019. Okay? And the law is very ambitious, itong UHC law. This is what it says. Ensure that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and protected against financial risk. Yan ang design. Paano ang implementation? So how do you then build better so you have better financing for your system? How can you design and build better so you have better service delivery in a situation where everything's sort of segmented or fragmented? That's actually the challenge. But let's proceed and let's look at what the DOH is saying. They will implement. What is their design for the implementation of the UHC law? Okay. Now, if you are going to build it, a better health system, you have to ask these following questions. Di ba? How do you weatherproof your health system from internal, external threats? The pandemic would be one of them as an external threat, which becomes internal when there's community spread. Well, how are you going to build capacity? Paano mo lalaksan ang kakayanan ng sistema? At saka ano yung capacity na i-build mo? And if you need to build excess capacity so that you have resilience, how much of it will you build? How do you build a system that's responsive to needs, current and future? Our population is growing. And that's needs. How do you build a system which is responsive to demand? Demand here meaning people will pay for it. How long will it take to build capacity? How much will it cost and who will pay? That's really the question of this presentation, the questions being raised in this presentation. How are you going to build better healthcare? Then if we were to do that, just some principles, and I got this, from this professor from Hopkins. And we know this. If you're going to change anything in the system, you have to realize that things are interdependent. So, for example, even if you optimize one part of the system, you could destabilize it and it doesn't work well. You can build a super duper hospital somewhere, but not have the system perform any better. Because every intervention will have multi-order consequences. That means up and down, vertical and horizontal, and across. And this one, which I want to emphasize, the organizational structures drive behavior. So the devolved public system has driven the behavior. Look at the behavior of many people, autonomous, kami na gagawa nito. There's very, very little synergy between local governments. And then, of course, the mental models will influence those actions. So that's, this is really what it takes to start to renovate. And so I go back to this, okay? How are we going to renovate that? And if you've worked in government before, you can't just abolish things. There are laws that mandated them. And if you are going to do anything new, you have to see how it fits with all of the other laws that have been written out. And so let's just look at service delivery. Okay, ito lang muna for this discussion. And look at service delivery as envisioned by the UHC law. Okay, and see what needs to happen if it's going to work. Okay, I'll show you some slides. These are all DOH slides on how they see the UHC law being implemented or service delivery. They say you're going to build a stronger primary care provider network. Okay, ibig sabihin yan, RHUs mo, district hospital mo, at least barangay health centers mo from the public system. And then that has to be merged with your private system as well. But you have to create that primary network. Paano natin gagawin yan? You have to build epidemiologic surveillance systems. Okay, sa ngayon lang, if you took an inventory, very few municipalities, have epidemiologic expertise. You probably need to build that at the provincial level, but is the provincial level being able to monitor and work with all of the municipalities, particularly if there's political conflict? And then, of course, health promotion programs that should be integrated. Okay, so just think of this. This is part of what the law says needs to happen for UHC. Ito, continued service delivery. This is for individual-based care. You want to have service quality for all standards across hospitals, public and private. Co-payment and co-insurance. Ano ibig sabihin yan? How much will be covered really? Can you expect that all of the hospital payments will be covered by PhilHealth? So ngayon pa lang, ang support value ng PhilHealth in a private hospital maybe 20-30%, depending on how much the bill is. So ang nangyayari na, kung indigent, sinasabi no balance billing. And of course, data. There is no information system that's integrated for your hospital system. And then look at how they've proposed to fund it. See, today they say funding financing is fragmented, low premiums. That's true. We're very low premiums for what we expect for PhilHealth. Okay, and then there are multiple pools. Kasi ang theory is health financing. If you're able to pool all of your sources, you have more leverage. Diba? But then again, some people will say, paano yan kung makurakot yan? But anyway, this is the proposed policy. I-merge mo lahat yan. The DOH, the individual level services, the SWD, and then you're going to create a big fund and then you're going to give it to the provinces. Ito yung next slide. Ayan. Magkikreate ng health fund to be managed by each province. The provincial health board will manage this special health fund. And what does the fund manage? See, all of the inputs will go there. And then this special health fund will fund everything. Tignan niyo yan. From the very, very expensive teaching training hospitals, to the primary, secondary hospitals, to the clinics, even to your primary care, for both private and public. That's the design. Look at this next slide. That will go to the province. Think about it, It's going to take a lot of capacity building for the province to manage that. At the moment, provinces are hard put to manage the epidemic, the pandemic. You're creating a mini PhilHealth in each province. And that special health fund here will have to fund everything. Can you imagine the type of financial management expertise that has to be there? See, PhilHealth will be giving the funds there. And they have to pay also the private providers. That's the conception. So with that, this is the envisioned integrated health system. You have all of your RHUs. Ito is public sector lang ito, wala pang private. Supposedly working so well with your secondary healthcare facility, which is usually what? The district hospital. Alam natin ngayon, RHUs don't work well with the district hospital. Sa ngayon pa lang . So there has to be some integration there. And then there has to be referral to a tertiary care facility, whether it's a provincial hospital or some other hospital. It could be a private hospital connected to an apex hospital. That's the design. And all of this is supposed to be working nicely, well-funded, public health services are there so that you prevent, unnecessary illnesses. Dengue epidemics are actually contained so that they don't flood your facilities. All of these things have to be working in this health system. So when you think about it, here are just some suggestions. These are just suggestions I give for discussion. There has to be a way of integrating functioning provincial and municipal health systems. I don't know if we can go back and I don't think we can re-centralize. It's too much of a political issue. We probably have to create a cadre of public health personnel who are really, who can make the connections all the way down. Okay, and maybe working alongside with your local health workers. And when you do that, you have to pay attention to the salaries and the balances there. But essentially, you have to have that type of very good integration. So use the strengths of a devolved system and complement it, because the issue here is strengthening national governance, which is very weak at the moment. You have to improve your health facilities, particularly your rural health units, which are, if you could improve all of that and really rationalize it, maybe we'll do better. And we have to create our information system. We could start with a disease surveillance system where you have reporting nationwide. The information system that we have is very, very also segmented, and it's very slow because it's still paper-based. And at saka yung laboratory natin, wala tayong laboratory system . Pero ang kailangan natin, a public health laboratory system to do the type of lab tests for public health. Ang nangyari was that yung mga laboratories na-integrate with a hospital. Tapos nawala yung mga public health laboratories. So the hospitals, in their labs, really attend to the needs of the patient who are confined. They don't do public health laboratory work. And then, of course, we have to raise our resources and use them properly. And then here, we really have to synergize with other sectors. For example, water and sanitation, food security. These are the things that we will need to do. So if you're talking about a platform that we could do, I put this all in a table and said, in the next term, gawin natin lahat yan. Magagawa ba ng gobyerno yan? In the next term, and maybe even 2 terms, but to complete it. And hopefully, we have begun to build better by creating more functioning and integrated structures to repair the damage, that was done by the local government code in fragmenting it. Or maybe another way of saying it is to repair the way it was implemented. If you say that the law was exemplary, maybe the implementation was very poor. And we are only now trying to implement it better. My second to the last slide, ito yung healthcare sa gitna. Pero kung iisipin mo, healthcare services lang yan. Sa mga health centers, sa mga clinics, and then public health, including pandemic control. Pero kung isipin mo, The other health-related concerns, water and sanitation, food, environment and climatic conditions, they're all in different sectors and they have to be very health conscious and do, policies that improve the health of populations. Same here, education and literacy, labor, poverty, alleviation, and of course, war and conflict. So we can only do so much in the health sector. Other sectors have to play their part. So ito po ang final slide ko. Just some of the things that we have to do constantly for a well-functioning system. I think there are 11 in this list. Ang linagay ko lang dito in bold yung pinag-usapan ko so far. Good governance, achieving synergy in all of the parts, and of course, investing. But when you think about it, there are all of these other things, from education and empowering individuals, communities, and institutions, promoting politics for health, emphasizing equity and social accountability. Ito, for human resources. How can you recruit and renew and retain the brilliant and committed if you don't pay them good salaries? And of course, leveraging your science and information to make good decisions. So salamat po sa inyong lahat and let's go and discuss all of these things. Thank you.
Thank you, Manalet. Galing ng ending mo, no? Let's all discuss this na po. We have 20 minutes to discuss all of these. If I may just start with a very quick summary of all that's been discussed. No? Inumpisahan natin a testimony from a health worker and patient ng COVID. And I think it's always important to start there. Nawawala yan sa media reports, no? And we just rarely hear from what patients go through. No? We also rarely hear from the families what they go through. Ako ay nagtuturo pa rin, no? Students who are dropping out because they cannot get Wi-Fi. Students who drop out because their entire family gets infected at sila ang taga-alaga. No? You don't get enough of these stories. And that is why I am hearing very often, may mga taong cynical, sabi nila gawa-gawa lang yan. And I cannot believe that there are still people who believe na gawa-gawa lang ito. No? Then we heard from Maristela nga about the situation of the frontline workers nga. No? Medyo may reaction sa mga iba nag-post dito na mga ibang ospital man nagbibigay ng benepisya. And we recognize that. No? But we also know that that many frontline workers are just not justly compensated at pati mga benefits. Sabi nga ng mga ibang kaibigan ko, di bale na ang sweldo, at least naman sana makatao naman ang treatment sa amin. Long hours, no protection, that is what really gets to them. Then we heard from Dr. Esperanza Cabral, who gave us a few important reminders. Because we're surrounded by COVID-19, araw-araw na lang yan. But she has several important wake-up calls that I wanted to reiterate. No? We have the longest lockdown in the world nga, no? And one of the most severe. No? Grabe, na ang bata hanggang ngayon di pa pwedeng lumabas. No? There's a whole generation that's growing up without seeing the streets. No? We heard from her about the exponential growth. No? I didn't realize that either na yung unang 500,000 cases natin nangyari yan in 1 year. And the last 2 months, we had another 500,000. We heard all the problems around treatment, around the ayuda. And medyo glimmer of hope. Sana kung magkaroon tayo ng effective vaccination system. But I did very quick math. Binanggit niya na 35,000 vaccinations a day. If you multiply that by 365, 1 year, ang total ay 12 million lang. No? We will be very far from herd immunity. They have to ramp this up. No? Nag-ano nga si Dr. Cabral sa Rappler recently, and she described it in very vivid words. It's a race against time. And I don't know if our bureaucrats recognize that. No? Then of course, kay Dr. Dayrit brings us into the realities of the past being connected to the present. No? I did realize also na ganun karaming mga batas tayo, no? 45 laws. No? And the question comes up nga is, are they well implemented? But I did want to say also, what was the intent of these laws in the first place? No? Like those malakas malasakit centers, we know that was political gimmickry. There is no intention to improve the public healthcare system. But I do not want to go into that right now. Pero mahalaga na binanggit din ni Dr. Dayrit, problems of decentralization, of segmentation, lack of coordination, of proper utilization. No? And I think Dr. Dayrit and Dr. Cabral were being very diplomatic. No? Parehong hindi binanggit ang big C. No? And the big C here is not cancer. No? In the end, Dr. Cabral did, was it Dr. Cabral or Dr. Dayrit? You used the word K. I think it was Dr. Dayrit. Natakot tayo pag dating sa decentralization sa local government ng ang universal healthcare. Baka kurakot, right? And it is the elephant in the room. No? We know that that is our problem as well, not just lack of coordination. Maraming nag-post na ng comments about Dr. Dayrit's presentation. I think that will need maybe another talakayan nga, which I hope some bayanan will be able to sponsor. Now we're opening the floor to questions, pero nagbato na ng mga tanong dito sa akin, and I had a head start here. I thought we should go back first to, baba muna tayo sa micro level, then pataas sa mga big questions. No? And there were two important questions in relation to COVID-19 itself. No? And I think it's appropriate, nandito si Dr. Cabral at Dr. Dayrit. No? Yung isang tanong dito, because both of you I know were involved with this question also, no? Yung opening up the transportation lines. Ang tanong dito, bakit pinayagan sa public bus ng aircon at sarado ang bintana? Hindi ba ito taliwas sa sinasabi ng DOH na dapat may sapat na ventilation? So can we ask Dr. Dayrit and Dr. Cabral to comment on this?
Actually, Mike, ulong-sulong ata sila dyan eh. Pero in the end, ang sinasabi is in a air-conditioned bus, I think periodically dapat bubuksan yung mga bintana. Kung babuksan ninyo for the ventilation. And of course, everybody, lahat ng tao doon dapat nakasuot ng mga masks. Ba, at may social distancing. Ang nagiging problema kasi yung yung ilang isasakay mo eh. Kasi marami sa mga private mga buses na ito, negosyante rin ang nagpapatakbo eh. And unless itong mga negosyanteng ito are subsidized, hindi nila malalakarin mga bus nila. Yun ang problema. Sila.
Yeah. And you're sort of touching also on the fact that public transport is also very much privatized. No? Kung sa gobyerno lahat ang dapat kung public system yan, we do not have to think of the profits that will come around from number of passengers. No? Dr. Cabral, did you want to comment on that as well? Maybe even on ventilation?
Yes, tama kayo. I think that in public transport systems, dapat mahusay ang ventilation, and if that is going to require opening the windows, that is what it should be. Pero meron naman silang sinasabi na in the MRTs, for example, yung mga air exchanges doon ay sinukat na nila at sinabi nila na equal to good ventilation naman sa loob ng bagon, miski na ito ay air-conditioned. Doon sa mga buses, palagay ko hindi ganon. I don't think they have actually studied the air exchanges in buses. Parang nagsisirculate yung air within. So dapat talaga yon nakabukas ang mga bintana. Huwag na lang, pasensya na lang tayo sa init, huwag na lang tayong maghangad ng medyo malamig-lamig dahil makakatulong sa atin na hindi magka-COVID yung pagbubukas ng bintana. But sabi nga ni Manuel, there are economic considerations as far as the people who own these buses and run them. They would like more people to ride their buses, so they will not they will not really want too much physical distancing. They will also want to have the air conditioning because some people are going to demand the air conditioning in spite of the fact na nakakasama ito sa kanila.
Okay, salamat no, Dr. Cabral at Dr. Dayrit. No? But I really hope also we do pay more attention sa message ng ventilation. No? Kulang na kulang nga yan sa prevention programs natin. No? Ang tanong kanina was from Tina Bawagan. No? Tapos there are 2 or 3 questions related sa vaccines. No? And I will just read both. No? And ask any of you to comment, pati na rin si Maris at saka si ang community health worker natin. Kasi apektado ang lahat. No? Yung isa is more technical. No? How many days after recovering from COVID before you can get the vaccine? I think may government guidelines yan on if you can handle it. Pero yung isa dito is from Dr. Mads Valera, more of a comment. No? But I think it's important to feature her yung observation nga niya kasi ito lagi ang naririnig ko. No? Typically, kung saan-saan tumatakbo ang mga tao ngayon, nagre-register sa local government sa barangay, kung saan-saan nagre-register yung medyo may kaya na may 3 bahay, sa 3 syudad, lahat na syudad pinapa-register nga. And despite that, medyo nahirapan pa rin na kumuha ng bakuna even if you are eligible as a senior citizen. No? And then Mad's experience was biglang nakakita siya ng sa isang ospital, madali lang kumuha ng vaccine. No? And what we're seeing here is there's a tendency na may survival of the fittest kung magaling kang maghanap. No? And sometimes it's even accidental. May isang kakilala akong UP professor, naglalakad lang siya sa kalsada, may lumapit sa kanya, "Sir, gusto ka bang magpabakuna?" Bata pa siya, sabi niya, "Syempre gusto ko pero bata pa ako." Sabi ng tao, "Report kayo bukas, no? Bibigyan ka ng bakuna kasi sir, may morbidity kayo. Ang taba-taba kasi ninyo." Ikaw vaccine the next day, no? As arbitrarily as that, no? So ang 4 na speakers natin may big quick comments here, including the question, kailan ba pwedeng magpabakuna after recovery?
I can take the last question, which is kailan magpapabakuna after recovery. Nagbago-bago din ang guidelines dyan. Dati-rate, sabi nila 3 months after recovery. Tapos naging 2 weeks after recovery. Ngayon, bago ka lumabas ng ospital, kung na-ospital ka, babakunahan ka na nila ngayon. So, ibig sabihin lang ay pwede kang magpabakuna right after recovery.
Yeah, okay. Salamat, Dr. Cabral. Si Aling Amelia, gusto ba niyo, nagpabakuna na ba kayo? Frontline
Hindi pa po.
Hindi pa. Nakapila na.
Ang banggit kasi is 3 months, kaya nakakalito po yung ganong sitwasyon. Kasi yung una, 3 months. Ano ba talaga yung totoo? Kaya yun yung makakapagpaalala rin po.
Yeah, okay. Maris, comment? Is Maris with us? Maristela? Okay, mukhang wala. Manolet, would you like to comment on the vaccination system? Ay, sorry, Maris is here na. Maris? Ay, nakamute kayo.
Ayan.
Ayun.
Okay po. Salamat po doon sa pagbibigay sa akin ng time. Ako po ay nabakunahan na ng AstraZeneca. Naka-first dose na po ako at waiting po for the vaccine to be available. Ang atin din po mga kasamahan ng mga health workers ay marami na po ang nag-avail ng bakuna. Kung ano po yung available doon sa kanilang ospital ay sila po ay nag-avail. At kung meron mang ilan na hindi nag-avail dahil naghihintay ng ibang brand, yun naman po ay ginagalang. Kaya hindi naman ho natin talaga pwedeng pilitin ang lahat ng health workers na magpabakuna sa isang particular na vaccine kung sa tingin po nila ay hindi nila ito prefer. Kaya po atin pong nire-respeto yun. Pero in general po, marami na po sa ating mga health workers ang nagpabakuna. Ang iniintay nga po ay yung second dose.
Yes. Thank you, Maris. Manolet, Dr. Dayrit?
Siguro ang mako-comment ko dyan, Mike, ito no, unang-una ako napakunahan na. So my first dose ako, AstraZeneca. Pero ang nangyayari ngayon sa pagkakaalam ko is that mahigpit sila dun sa prioritization. A1, A2, A3, A4, and so on and so forth. Kung hindi nyo sinusundan yan, ang ibig sabihin ng A1, health workers, A2, seniors, A3, those with comorbidities, A4, yung economic frontliners. Meron pang B, di ba? Ngayon, talagang very strict dyan sa prioritization because of the
supply.
Limitations sa supply. Okay? Ang observation ngayon, ang A1 at ang A2, relatively, madali gumawa ng master list yan. Kasi meron kang mga listahan eh. Lalo na sa mga ospital. Alam nila kung sino yung mga health workers doon. Tapos yung senior citizens, nakalista sila sa office ng OSCA, di ba? Pero pagdating mo na doon sa mga comorbidities, pagdating mo na sa economic frontliners, hirap gumawa ng master listing. Yan ang challenge. And that is really what's probably going to slow down the immunization. Kasi people have to be pre-registered eh. And so how do local governments actually pre-register them? And they have to open up systems para maka-register ang mga tao. Eh yung mga tao na hindi gumagamit ng internet, hindi sila ma-register. Kailangan humanap ng paraan. So yun ang unang-unang point doon. And therefore, kung isipin ninyo, if yung herd immunity na binabanggit nilang target of 70 million, ang ibig sabihin yan, 140 million doses yan.
Yes.
If you're targeting 2 immunizations, di ba, per person. If you look at the way we've moved, we're 2 million now, and that was for 2 months, actually March and April. So we now have another, June to December to try to make up and reach 140 million doses. The supply will only come by November, December. Nung nakita ko yung listahan ni Secretary Galvez, we will reach 128 million supply by November, December. That means in that last quarter, about 50 million vaccines are expected to come if they come in. Okay? Pero ibig sabihin yan, kung magamit natin yung 70 million na nauna, that would be great. Pero sa I think yun ang challenge kasi hindi lahat ng mga LGUs handa eh.
Yes.
Tsaka siyempre, hindi rin ganun kadali kung private sector ka, gusto mo magbigay ng bakuna kasi magpapa-accredit ka eh, to be able to give vaccination. So you have those problems, yung master listing on the side of those that should be vaccinated, and then the readiness of the sites on the side of those that are giving the vaccination.
Hey. Naku, ang daming lumilitaw dito na can I check with the Secretariat hanggang anong oras ba talaga tayo sa open forum? 3:23 tayo ngayon. Organizers? Para lang ma-timing ko rin na okay, we'll confirm. Okay, in the meantime, while they're confirming, I think we can move to, okay, some of these questions are going to be, and comments nga, no? Parang may trend kasi dito na the big picture, no? Which will be a bit more difficult to handle pero kailangan ding talakayan, no? How much of our problems come from neoliberal policies, no? Such as privatization, commercialization of public health services, no? And i-combine ko na lang sa mga iba, no? Si Edgar Gahisan says, is it time to renationalize our healthcare system? Actually, gusto kong sagutin, we never had a national healthcare system, so there's nothing to renationalize. No? Doon tayo huli nga compared with other countries. No? Can we reintegrate? No? I think that was a term kasi Dr. Dayrit was using a lot na pwede kayong ibalik ang provincial healthcare back to the national, or at least to something higher than them. No? So that those questions keep recurring. So
paid na yan,
I'm sorry.
Sorry.
Okay. Pero nakuha ba ninyo more, ito yung pinaka-macro level kasi na baka ang ugat ng mga problema natin is that our policies are shaped with a bias for the private healthcare system and actually against having a public healthcare system. That would be my interpretation here. So all you can comment. No?
Yeah, siguro Mike, if I may comment there. Actually, kasi yung nangyari sa development ng sistema natin, public-private ginaya natin yung sistema ng US. And so even the mentality ng mga tao, it's a public-private system. And if you want better services and you can afford it, punta ka dun sa private. Ngayon, conscious rin na kailangan palakasin yung public health system. Ngayon, may tanong nga dyan, like si Delen is asking, paano yan? Hindi ba dapat tax-based instead of social insurance?
Yeah.
Okay. Alam mo, ang tanong dyan is, can you then pass a law that's going to change everything? Kasi everything's been designed this way. And therefore, it's going to be a massive commitment. Talagang, and the administration will have to work in a legislative agenda to move towards a tax-based system. Ang ibig sabihin yan, it's just taxes that are going to pay for it. And then, the people will simply have to pay their taxes. Hindi na sila magbibigay ng social insurance payments. Kasi either way, even because the PhilHealth premiums are in a sense another way of taxing ourselves. Diba? It's another way where government taxes us when we pay our social insurance. It just goes to another organization that's going to minister the funds. So I guess yung lawmakers, when they were thinking about this already in the past, ganun ang nangyari. But kung titignan mo yung mga ibang sistema, even Thailand, which is a very strong public health system, ano rin sila? May social insurance system rin sila, where individuals contribute towards their healthcare. Tapos kung titignan mo ang Singapore, there are 3 tiers to their system. And sa Singapore, it's mandated. Mandado ang mga tao na maglagay ng pera sa savings that will go towards future use if they get hospitalized. So, I guess that's the answer that I can give kasi it's a theoretical point at the moment unless you can really change the laws. Yun ang reality because if you can't change the laws, this is the system we have to live with and we have to improve it.
Okay. Dr. Cabral and
Yes.
Yeah.
Let me just comment that what happened, I think, with the public health system, say the public hospital system, is that at some point in the past, the hospital system, the hospitals were obliged to earn their own money.
Sa Bayan.
At yun ang naging malaking problema ng public hospitals. They all now have the ambition of becoming private hospitals. Kasi sinabi sa kanila ng gobyerno, aba, kumita kayo ng pera ninyo para meron kayong magastos. Which is very wrong because these are serving poor people. Who are they going to get their money from? The idea should be that these public hospitals should be fully supported by the government, paid for by taxpayers' money, or by the Philippine health insurance system, by PhilHealth. But they should not be obliged to raise their own money.
Halaga yan, no? Very, very important point. And again, maybe because we won't have that much time, but it really should come up in another forum. No? I would just love to see a forum. Whatever happened to our sin taxes? Bilyon-bilyon ang nakolekta dito. Saan ba yan pumupunta? No? Of course, the funds that went to PhilHealth, we know what happened to that. No? And we keep going back to the elephant in the room. So kasama din yan sa discussions. No? Maris at si Amelia, may dagdag ba kayo dito around privatization? Alam ko malaking issue yan sa HW.
Sa tingin ko, kailangan pagdating sa pagpapalakas, naririnig po ba ako?
Medyo mahina ng konti.
Okay. Ngayon, naririnig po ba ako? I'm sorry.
Lakasan na lang boses. No?
Hello?
Yes,
Naririnig na po ako ngayon?
Yes, very good.
Sa tingin ko po, kailangan talaga natin sa ngayon palakasin yung ating public health system kasi in terms of manpower po, kulang na kulang din tayo. Sa amin po, sa mga health workers, sa tingin namin dapat dagdagan ang mas hiring, lalo na sa mga public health. Halimbawa po, sa mga nurses, sana bawat isang barangay ay mayroong isang nurse. At sana po ay lahat ng barangays meron talagang isang public health nurse. Pero sa ngayon, out of 42,000 barangays, less than half pa lang po ang meron tayong mga barangay health stations or rural health units. At sana rin po ay madagdagan ang ating mga manggagamot. Ang kaamin pong mungkahi ay bawat 1,000 population, sana may isang doktor. Kung gusto natin talaga na matutukan yung pangangailangan ng mamamayan sa ibaba. So hindi lang dapat naka-focus tayo sa COVID o anumang pandemya, kung hindi, pati po yung mga non-COVID na kaso natin ngayon sa public health na hindi naman nawawala. In fact, patuloy pa rin po yung tumataas.
Salamat, Maris. No? Aling Amelia, may dagdag ba kayo bilang community health worker?
Sa amin po, mahalaga rin po na i-develop yung community health worker, lalo na po sa mga komunidad kasi napakahalaga po ng papel nila doon sa magkakapitbahayan. Kasi sila po ay makakapag-develop din at makakapagturo no ano yung kahalagahan ng kalusugan dahil binabanggit nga natin ang kalusugan ay karapatan nating lahat. Kaya mahalaga po na kilalanin din yung mga community health worker.
Okay. Yan. Medyo yung pinaka-recent na post dito ay galing kay Loretta Ann Rosales, no? But I will read it kasi may ugnay dito din sa yung katatapos lang nating na discussion dito, no? Na while it is true we are patterned after the US system of strong private interest, it's also a matter of public accountability where the bureaucracy is used for private interest rather than a public good and common service, no? Kaya pabalik-balik tayo dito na who is being served, no? Whose interests are being served in here. Okay. May isang temang dito no, tungkol sa kababaihan. I will save that for the last, no? Pero mukhang nag-mobilize ang kababaihan dito kaya maraming nag-post ng comments and I think we can bring them all together, no? I think there's yung kung babalik muna tayo sa then we'll go back to the big picture because this comment here is interesting kay Fernando, no? Who says that our hospital personnel have received their second dose of COVID vaccine, mainly Sinovac. We are now monitoring PCR tests na sa hospital employees and several of them have come out positive despite being vaccinated. But majority are asymptomatic. No? I cannot give the numbers because they're still ongoing. My concern is these asymptomatic COVID positive personnel were not aware they were infected until the routine test was done. I think there are two issues that come out here, no? What vaccines actually do. Tapos I don't know ilan ba talaga ang lumilitaw na positive after the vaccination. Would our doctors want to comment on this?
Okay.
Mm-mm.
Mike?
Yes.
Oo. Hanggang ngayon kasi, we do not know the sterilization rate of the COVID vaccines. We don't actually know whether they will kill all of the viruses, and if you are vaccinated, you cannot carry the virus anymore. In fact, some studies show that you may be carrying the virus, but you are already protected. And so you may carry the virus and infect somebody else, even if you yourself will not develop the disease. So may ganon. And that's actually the reason kung bakit sinasabi nila na miski na nabakunahan na tayo, ay kailangan pa rin natin mag-practice ng health protocols hanggang hindi natin naliliwanagan to what extent the vaccines can sterilize somebody and to what extent a person who has been vaccinated can pass the virus to other people.
Okay. Manolet, did you want to add anything there?
Yeah, tama yung I agree totally with what SP said. Siguro I can add lang is, what they're saying is that yung vaccination will protect against serious disease. Pero the studies don't show that it will prevent people from transmitting it. So that's, malalaman lang natin yan kung they're done.
Yeah. At mukhang kailangan din yan sa public information campaigns. No?
Yeah.
We have to alert. Well, they know, no? IATF knows. No? At nakita natin ang daming mga tanong tungkol sa bakuna nga. Tinitingnan ko lang ang oras. Ang sabi ng mga organizers, pwede tayo hanggang 3:55 at willing din naman akong mag-moderate up to that time. Pero sa mga tanong, isasara na natin. No? Maybe we should still tackle konting lang sa bakuna, tapos babalik tayo sa yung isang larangan nga na the big picture again. No? Kasi some of the questions here are quite valid, no? Na sana naman may take out din tayo after this workshop na some of the things na practical day-to-day realities. May ilang nagtanong na ulit na ang Sinovac ba, di ba hindi pwede sa senior citizens? I believe it can be for senior citizens, right? Correct me if I'm wrong.
Pwede na, Mike. Pinayagan na
Pwede na, no? Pwede.
Pinayagan na nila.
Yan din ang alam ko eh. No? Ang AstraZeneca ang pinayagan naman for the younger groups, or are they saving them for the old ones like myself?
Tama yun. Ginagamit na din yung AstraZeneca sa mga mas bata.
So pwede na rin. Okay. Naku, kinig kayo kay Dr. Cabral kasi cardiologist siya, no? And there were questions about the blood clots na ako rin AstraZeneca eh. Sabi nga ng mga doktor nung sabi nila, ay naubos na ang Sinovac kaya Astra. And that was the time may namatay sa Europe. Sabi ko, ay salamat sa inyo. Anyway, the other questions are, will we need boosters? Well, we still don't know, right? That's the big question as well. Again, dagdag ba kayo, mga Dr. SP and Dr. Manolet? We don't know, right?
Tama yun.
At mukhang baka kailangan. No? I don't think it will last that long.
Yeah. Pero Mike, ang kasi is, kung titignan mo yung pattern,
nag-garble ka. Pakiulit nga.
Yung sa atin, nag-pick tayo.
Manolet, hindi klaro. Sige,
this month, no? March, April.
Again. Can you repeat?
Several months later of peaks and valleys. And therefore, kailangan talaga ng
ulit.
and boosting. That probably is the wave of the future.
Yeah. Okay. Although nagarble, I think the gist of your message is mukhang that might be the wave of the future. No? And I think kailangan malaman din ng mamayan na no, I think it's too early to talk about a post-pandemic era. It's not in the near future. Ako ay educator, we already have word, online pa rin ang first sem natin. We are still a long way off from it. So lumaban tayo for a better normal nga, better future nga. No? Which takes us back again to some of the big questions that are being raised in here. No? Yung why are we underfunded? No? Why are we being underfunded nga? Tapos may combination dito, can we defund military spending? Parang rhetorical questions na yan. Ano? Why are we underfunded? I don't think the money is there, but we know where it's not being allocated. The priorities are not there. No? As for defunding military spending, I think we can all agree. Start with defunding the intelligence, the military intelligence. No? Medyo contradiction in terms yan, pero ibang bagay na yan. No? Okay. Medyo variations kasi ang mga tanong ninyo dito. I had it written down na. Okay. Looking at the time again. No? Maganda yung pinasok ni Maripay FEE kasi Reyes. No? The problem is that we will have people running for offices and getting elected without the necessary knowledge about healthcare. And then may ibang nag-ano dito na shouldn't we be preparing an election platform? Okay, yan na. I think we are seeing signs of a platform that should be an agenda that should be presented to candidates, right? But can we ask our 4 speakers to speak up here na after all, nagtayo tayo ng sambayanan nga with that idea in mind na lahat tayo ay para sa demokrasya nga at kailangan kumilos na for next year. Maybe I can ask the 4 of you to talk about, maybe to make it more systematic na ano ang pinaka-importanteng panawagan para sa platform natin sa kalusugan. Start natin kay Aling Amelia.
Maraming salamat po. Ang pinakamahalaga po yung iprioridad talaga yung sistemang pangkalusugan ng lahat ng mamamayan dahil napakahalaga po nito. Una po yung information drive natin na lahat dapat ng mamamayan ay mabigyan ng kaalaman para sa ganun. Kasi sa kasalukuyan po hindi pa rin nila unawa yung COVID. Kaya napakahalaga po ng information drive para sa kanila.
Okay. Salamat, Mami. Maristela?
Mahalaga na itaasan yung ating health budget. Taon-taon na lang kasi lagi tayong kulelat pagdating sa prioritization. So sana this time taasan at tignan yung mga proposal ng health workers para dun sa pagtataas ng budget. Dahil gusto natin na isama yung kapakanan at welfare ng ating mga health workers dahil hindi naman talaga maipapatupad ang maayos na health system o healthcare delivery system kung ang ating mga health workers ay kapos, kung kulang tayo at kung meron man tayo ay hindi natin pinapahalagahan. So priority na magkaroon ng balance doon sa prioritization at tignan talaga ang value ng ating mga health workers sa lahat ng pagpaplano natin sa kalusugan.
Yeah. Before we go to our 2 doctors nga, pahabol na tanong din dito, Maris, no? Kasi may nagtanong na pwede ba yan yung demotion ng ano? Nagulat din ako, no? At gusto ko lang banggitin, no? Kasi nasa board din ako ng isang ospital at alam ko nagbabayad kami ng sapat na wages nga. In fact, ang problema nga namin was yung tinalakay dito. Incidentally, nasa board ako pero hindi ako shareholder. Ha? Ako ang independent director now. Walang pera kasi kaya independent. No? Anyway, ang lumitaw dito, private hospitals are actually feeling threatened by Department of Health kasi supposedly, di ba, 32,000 ang entry point ngayon.
Yes.
So hindi totoong pumapasok ng gano'n na at demotion ba? Pwede ba yan? Ang demotion sa nurses?
Nagulat din kaming lahat, Dr. Mike, dahil yung inaasahan namin, pagtaas ng sweldo ng entry salary, maipapatupad ito ng pantay-pantay sa lahat ng health workers kasama mga contractual dapat. Pero hindi naiwanan ng mga contractual. Pareho naman ng job description. Tapos yun nga hindi maganda doon, naglabas pa ang DBM ng ganitong circular na ibinaba niya ng isang rank mula nurse 2 hanggang nurse 7 without even consulting yung mga nurses natin. Sana man lang kahit at the hospital level na consult or yung mga hospital nursing organizations natin na consult. Pero ito yung ginawa nila, ang sabi ng DBM dyan, dahil gusto daw nila na i-accommodate yung implementation ng SG-15. So ang sinasabi nila, dahil from salary grade 11 tataas ng SG-15, kailangang ibaba. Doc Mike, kasi yung nurse 2 position, dati ng SG-15. So nung yung nurse 1 ay ginawang SG-15, naging pareho na sila. So imbis na itaas nila yung nurse 2 ng salary grade, ang ginawa nila, ibinaba nila. So para SG-15 na rin. So ngayon, dalawang nurse 1 position. Ang iba diyan senior na, may mga masterals na, tapos yung isa yung entry position. Ang hindi pa maganda, binaba pa nila lahat from nurse 3 to nurse 7. Kaya even yung pinakamataas, yung nurse 7 na-dissolve yun. No, wala ng chief nurse position, naging assistant chief nurse. So nurse 6 na lang ang natitira. May bearing ito sa job description, may bearing ito sa patient care. So kami tinututulan namin yan at sinasabi namin na ibalik na lang yung dati na mga position nila at yung nurse 2 itaas ng isang grade from salary grade 15 gawing salary grade 16 at budgetan na lang talaga lahat yan. Kasi ang posisyon na currently meron sila bago na demote ay pinaghirapan nila ng maraming taon. Ginugulan nila ng maraming pag-aaral yan para maabot nila yung mga qualifications. And then all of a sudden, instead na ma-promote sila this year, wala na-demote pa sila. At yung iba nag-retire na ang position nila ay yung demoted position, which is very bad talaga in terms of decision making ng TBM.
Thank you sa clarification. But that's certainly an issue, klarong-klaro na kailangan ipasok nga sa political agenda nga. No? At kulang talagang hindi lumalabas sa public tungkol dito. Ang alam ko rin ang demotion ay bawal ng Civil Service Commission no? Kasi sige, gobyerno. No?
Sinabi po niya na kahit pa ito ay maging pareho pa rin ng sweldo, the moment na binaba mo yung rank, yung job description at iba pang task ng isang personnel, demotion pa rin ang tawag yan at bawal po yan.
Yes. Okay. So ituloy natin kay Dr. Cabral at Dr. Dayrit naman na para sa inyo, anong pinakamahalagang panawagan kung magbubuo tayo ng common election agenda nga sa kalusugan.
Para sa election agenda ba yun? Actually, Mike, ako ang pinaka-importanting panawagan ko para sa kalusugan goes beyond the health sector or the health department. We will always get the government we deserve. So hanggang hindi tayo natututo na maglagay ng mga tao with integrity at who will put the public interest ahead of themselves, walang mangyayari sa atin. Miski na sabihin natin na unfair ang ginagawa nila, wala naman tayong magawa. They do this all with impunity because they can and they want to.
Because they can and because they want to.
Yeah.
But we also can if we want to, right?
Correct.
Next election. Umaasa. Manuel?
Sorry.
Well, agree totally with what everybody said, including sinasabi ni SP. Pero kung titingnan lang natin yung health system o yung health sector as I presented it, para sa akin we really have to strengthen yung public system. So tama yung sinasabi ng comment dyan, that even if we're a mixed system, private and public, we can still try to have an excellent public system. In fact, if you put money in it, aangat yung public system eh. Tignan mo yung mga, of course, people complain that they're corporatized, di ba? But look at the heart center, the kidney center, di ba? They were at par with many of the private hospitals. Technology and the people that were working there. But you have to invest in it and you have to nurture it. Para sa akin, the weakest part of it is yung primary system. And if we can strengthen that, and I think kailangan baguhin yung configuration yan eh. Kasi halimbawa, nagtrabaho ko sa Northern Samar and some of the poor municipalities. You have to look at the system and decide how you can rationalize it. You don't have to keep all of the district hospitals open. You can create a system na well-funded yung hospital mo, make the connections with the RHUs and they can all be integrated. As it is now, they're not. They're even cross purposes eh. In competition yung district hospital dun sa RHU. Pero kailangan mong i-integrate yun. That system. So if we can do that in the next term, I think malaking advance yan. Kasi we don't have it. And that's a primary system that will be your first defense against any pandemic. I-connect mo ngayon yan with good information all the way to the top in terms of your surveillance.
Yeah.
And I think you'll have a better system. So for me, if you were talking platforms, I'd focus on that. Thank you.
Thank you, Manalet. No? Now that you mentioned the health information, so yung alliance ng mga the professional health groups, no, they told me nga na nung November pa sila kay President Duterte ng ilang mga kailangan gawin para sa COVID. At ang isa ay improve naman yung satellite connections for communications kasi yung epidemiological information hindi nga maabot sa ang tagal-tagal ng just to get it to central nga. And he did not sign this simple executive order to get the connections going. He didn't sign it until February. And syempre, alam natin na medyo matagal po yung bagong ma-implement. Pero ang pumapasok dito is there are certain things that we have to do at the primary healthcare level, but we also need to tap into the technologies that are available. No? And I think it's important to remind the audience, kaming mga mas may edad, kami ni Dr. Cabral and Dr. Dayrit, there was a time when we were producing our own vaccines. No? I forgot about it, pero nagbanggit si Dean ng College of Medicine. Alabang was the lab in Alabang used to produce BCG vaccines. And then as a vet, alam ko rin na may rabies vaccine production. Tapos, we neglected it, no? And now we are paying for it because of our total dependence. No? Si Dr. Araulio was asking, what about Cuba as a model? And I wanted to say, Cuba, ang liit-liit ng bansa na yan, they are developing their own vaccines and they might be able to roll it out in the very near future. No? Tayo, ang laki-laki ng population, we could have sustained the demand there with our own production. No? Ngayon, rather belatedly, we are putting up a virology institute. Nagulat ako ngayon lang mag-virology institute after all these years. No? So, there is neglect. No? And I hope that this can be put into our agenda as well. No? Okay. Mga ibang tanong dito tungkol kay Duque, mga no? Talk about elephants in the room. I think obvious naman yung tanong dito. Pero may isang nagtanong, di ba dapat immobilize ang militar para sa contact tracing? Ayun, yan nga ang problema natin. Kung saan-saan pumapasok ang militar, kaya takot ang mga taong magpabakuna, magpa-contact tracing, magpa-quarantine. No? I hope we learn our lesson there. No? Unfortunately, malapit ng time ending and there's one last cluster of questions that I wanted to refer to. Maraming nagtanong nga, ano ang nangyari nga during COVID na nasakripisyo ang mga programa para sa kababaihan, family planning, reproductive health. No? There are different variations here, no, on the questions nga. Related also na ang kababaihan ang frontliners, no? At binanggit dito hindi lang mga healthcare workers hanggang supermarket no? Cashiers. We know that from the start of the lockdown. Kaya basically lahat na ito pumapasok nga sa tanong na ano ang mga polisya na upang higit na mapag-alagaan ang mga kababaihan. And the other questions related to that din, hirap na hirap ang kababaihan. I think it's rhetorical, no? And maybe it is Tessie Angsi who sort of gives an answer in her comment. No? Sabi niya, kung may babae lang sana sa IATF, hindi SAR ang tawag sa mga managers. Ano ang alam ng mga tao sa SAR na yan? Tama nga. Ang mga lalaki kasi ang may hawak sa COVID, kaya mas mahalaga sa kanila na maging SAR sila, right? CZAR, no? Ang kailangan natin ay hindi SAR kundi ang mga makataong leader, no? At tama din may nag-post na 'di ba ang Taiwan medyo maganda na actually may lumabas na study last year pa na the countries where COVID control programs have been running very well are countries headed by women leaders, no? Prime Minister, Chancellor ng Germany, no? Posibleng kasi mas may puso ang kababaihan nga, no? So it's leading me to yan nga nagtanong pa kayo, alam naman natin kung anong sagot dito, no? Maghanap tayo ng babaeng presidente. Wag naman. Nakaranas din tayo ng babaeng presidente na hindi okay. But I just wanted to use that opportunity to point out. Kanina pang remind sina Jojo, naanap ko ngayon ang datos. No? Nung May 5 pala ay International Midwives Day. Nung May 7 ay National Health Workers Day. At ngayon pala ay Nurses Week. No? And coming up this weekend is ano pang mahalaga para sa kababaihan? Mother's Day. No? So, akmang-akma din itong forum natin, no, tungkol nga sa kalusugan kasi alam natin na the frontline workers, the majority of healthcare, hindi lang sa ospital kundi sa mga tahanan natin ay hawak ng kababaihan nga, no? And the discussions today, we got very, very technical, no? And yet we keep going back to the point nga the people who bear most of the burden for our healthcare system ay kababaihan natin, whether nurses or nanay, midwives or a woman mayor. And perhaps it's time that we become more, not just gender sensitive, but to recognize the leadership that is found among women. And I'm not making a pitch for any presidential candidate at this point. Ang punto lang dito is tularan na lang natin ang mga kababaihan natin na may puso nga at may utak, no? We tend to underestimate how buti na lang ang interpreter natin ay babae din, no? Nagkano siya, no? Puso at utak, no? So mabuhay ang mga kababaihan, mabuhay ang bago nating alyanso dito, no? I turn the microphone back to our organizers. Baka may announcements kayo or may naligtaan dito.
Mike?
Oh, sorry, ang dami pang tanong. Yeah.
Marami pang tanong.
Si Attorney Howie.
Si Attorney Howie ang magsasalita. Closing remarks.
Sige.
Yes, good afternoon.
Yes.
Can you hear me, Dr. Mike?
Yes, we can.
Yes, thank you, Dr. Mike again. Salamat po sa napakagaling na pag-host at pag-moderate ngayong hapon. Salamat din sa ating mga health workers, sa ating mga frontliner, nurses and doctors alike. My heart goes very close to the health profession especially, no? Having siguro hindi alam ng marami, health worker din po ako. I'm a physical therapist also before I became a lawyer. So that's one more thing. So again, before I give my closing remarks, I would like to thank Jay and Ember, yung ating mga sign language interpreters. And of course, thank you very much to Amelia and Maristela, and of course our two speakers, Secretary SP Cabral and Secretary Manuel Dayrit. Salamat po ng marami. Kanina po, marami na pong mention yung ating pong elephant in the room. And it is very clear, hindi po kailangan sabihin, pero in all of the data and all of the statements being said, it is very clear that our health system is very politicized. It is very clear also that the pandemic response is very much politicized. At sinabi na nga, merong questions of corruption and weak leadership. But siguro, let us just move forward after this webinar. Let us have a roadmap to recovery, to a pandemic response recovery, and it can begin with adequate and proper government response to a proper healthcare system that is really adequate and what the Filipino people truly deserve. Ngayon po, kami po sa Isang Bayan ay nagpapasalamat ulit at nasasayahan dito sa webinar na ito. Hindi naman po ito ang first and last. We would have a series of webinars again at ito bibigyan po natin ng pansin ulit yung committee ni Dr. Lenny Hara. So salamat po sa bumubuo ng kanyang committee na bumuo din ng ngayong webinar na ito. We are likewise committed to bringing the healthcare issues and other issues discussed today to the forefront of government concern. And sa amin pong motto na tapat na pamumuno and good governance, we are confident that we can be on the road to recovery. And it is only a matter of time that the pandemic will be solved, and hopefully any other new strain or any other pandemic will be properly addressed through good health system and through good governance. Now, as we look forward to our economic recovery, we all know that the key to a good economic recovery and a healthy economy is a healthy citizenry. And we can do that together. Sabi nga ni Dr. SP kanina, we can and we will. No? We can do a better and we can give a better alternative to the Filipino people. And we start that by being united. Kami po sa Isang Bayan ay kumukuha po ng isang unification ticket. At sana po, hindi lang po ito unification ticket for 2022, but also a unified response for good governance from 2022 and beyond and the decades to come. Salamat po at magandang hapon po sa inyong lahat.
Wait. Sinong magko-closing? I mean, nag-closing na si Attorney Howie na ano. And it's good to know pala PT kayo ha. So adopted ka na sa atin sa health sector. No?
Opo. That was my first profession before I become a lawyer.
Sige, thank you.
Okay. Who will close now?
Kung kaya mong isipin, kaya mong gawin, isa-isang hakbang lamang at ika'y makakarating. Tulad ng puno na galing sa binhi, ang mga dakilang gaway nagmumula sa guni-guni. Kung ang nais mo'y maging malaya sa mundong puno ng paningin, buhayin sa malayang paraan at sa araw-araw na pakikitungo sa tahanan at lipunan. Buhayin sa sarili ang malayang paraan. Kung kaya mong isipin, kaya mong gawin, isa-isang hakbang lamang at ika'y makakarating. Tulad ng puno na galing sa binhi, ang mga dakilang gaway nagmumula sa guni-guni. Kung ang nais mo'y maging payapa sa mundong puno ng digmaan, buhayin sa sarili ang payapang paraan at sa araw-araw na pakikitungo sa tahanan at lipunan. Buhayin sa sarili ang payapang paraan. Kung kaya mong isipin, kaya mong gawin, isa-isang hakbang lamang at ika'y makakarating. Tulad ng puno na galing sa binhi, ang mga dakilang gaway nagmumula sa guni-guni. Kung kaya mong isipin, kaya mong gawin, isa-isang hakbang lamang at ika'y makakarating. Tulad ng puno na galing sa binhi, ang mga dakilang gaway nagmumula sa guni-guni. Ang mga dakilang gaway nagmumula sa guni-guni.
Gandang hapon sa lahat. Maraming salamat.